There's a few others who have not shown their faces, but I see them on that they are present for sure.
Welcome, Dr. Jutani.
Thank you.
We're live.
Okay. Good morning, everybody. We will officially call the Executive and Legislative Nominations Committee public hearing to order. We welcome everybody today. We have a few items on our agenda today. We have three people who wish to be commissioners permanently from their acting roles, who we know have worked hard over the last few months for sure. First, we'll start with Manisha Juthani. I'm sorry, before we get that, Mr. Chair, any comments?
Thank you, Mr. Chairman. No comments other than good morning to everyone and look forward to the conversation.
Good, excellent, thank you. First, we'll go with Dr. Manisha Juthani of Southport to be Commissioner of Public Health. Dr. Juthani, now that you are in your full name and we're not confusing you any longer with Commissioner Bartolomeo, you all set?
Yes, I'm all set.
All right, perfect. Would you raise your right hand, please? All right, do you promise, swear, affirm, tell us the truth, the whole truth, and nothing but the truth?
I do.
All right, thank you. And feel free to start off with a statement if you'd like.
Thank you very much. Good morning, Senator Duff, Representative Concepcion, Senator Kelly, Representative Kennedy, Senator Looney, and Representative Quinn. And thank you for the opportunity to testify before you today on my nomination for Commissioner of the Department of Public Health. So I wanted to take just a few moments to tell you my story and tell you my background. And my story is really one, I think, of the American dream. My parents were Indian physicians, are Indian physicians, and came from India in 1970 to the United States to pursue education, to pursue a better life and opportunity that America has to offer. I was born in New York City and raised in New York suburbs. And when I was in high school, developed an interest in science and decided to be pre-med, following my parents' footsteps. Went on to the University of Pennsylvania and then to Cornell University Medical College in New York City, where I did my medical training. And it was there in my first microbiology class that I first developed an interest in infectious diseases. I went on to then do a residency at the New York Hospital in Manhattan. And when I was an assistant chief resident, this was a primarily educational role, I found I was always wanting to teach about the infectious disease cases. There was always something new, always a new pathogen, as we've seen with COVID-19, always something to keep you on your toes. And I saw and learned about a case of a young woman, 18 years old, NYU student, who developed typhoid fever, which was very unusual because usually you get that if you travel somewhere where that disease is endemic in the community. And she hadn't gone anywhere. And it was reported to the Department of Public Health in the city of New York. And they had 2 or 3 other cases that were also identified. And through very good public health tracing and case investigation, they identified a fast food restaurant in Queens where everybody had gone. And they went and then surveyed the staff there. And there was one staff member who was chronically colonized with Salmonella typhi and shedding on a regular basis, which contaminated the food through poor hand hygiene. And it was really through basic public health principles that this case and cluster was identified. And that's what really got me excited and interested in infectious diseases and public health. And from there, I went on to do a chief residency at Memorial Sloan Kettering, came to Yale in Connecticut in 2002 when I started an infectious disease fellowship. And I've been in Connecticut for the past 20 years. And it's been my home since that time period. And as an ID fellow, I realized that although these exciting and different infections, unusual infections were exciting in some ways, our population in large part is dealing with infections that are very commonplace, like urinary tract infections and pneumonia. And I decided to focus research on a population that is most vulnerable and most susceptible to infections, which is nursing home residents. And because of that, I really have been to 50 different nursing homes in the state of Connecticut, really, as I recruited different places to do research, but I never would have imagined that that exposure would have prepared me for this job that you are all considering me for today. And in the role that I've had in the last 5 months, those skills have already been put to good use by really knowing what's happening on the ground and what's happening in those settings. So I give you that all as background and just want to summarize that I have been working hard at this job. I think you've all seen me in some respect or another over the last 5 months. And aside from COVID-19, which is obviously the thing we all need to deal with, there are many other areas of priority that I think are important to address. So first and foremost, revitalizing public health. There's so many things that have been put on the back burner during this pandemic. Climate and public health, I think, is going to be a huge problem in the years to come, and I really hope to focus on that. Workforce development, whether it's in healthcare or in public health, we really need to revitalize a group of people who can come to the forefront in really caring for patients and really bolstering local health and helping all of them be able to execute the things that we in the department at the state level help establish as guidance and guidelines for local health departments. And through all of that is really an equity lens, which I will continue through all the work that we do. So I will stop there and am open to more questions. Thank you for this opportunity.
Thank you, Commissioner. Appreciate it. And thanks you for your succinct testimony, because I'm sure there'll be a number of questions. I'll just kick it off. We appreciate everything you've done during the pandemic and coming in and really in the middle of that. I'm not sure that that's in anybody's job description, is to take over in doing public health for a state in the middle of a pandemic, and it's got to be extremely difficult. What was kind of the biggest learning curve, I guess, for you coming from Yale to coming to a State Department, and again in this very difficult time?
Thank you for that question. So I would say that I first observed that people working at the state and in the state work really hard. That is one thing that was something I was struck by. And I think I understand much more why the government in general often operates under org charts. And knowing sort of who reports to whom and structure is so important to be able to really understand the flow of information. And there's a reason why org charts are in place. I think that was something that I saw very quickly early on. And I also, obviously we have a very large team here at DPH relative to the teams that I was supervising in an academic environment. And so those were some of the transitions that, I had to quickly make. I also quickly learned that as a department in the government, much of what we do is dictated by laws that all of you make, and that our responsibilities are dictated by the laws by which we must operate. And that was a new area for me, one that I've learned a lot about. And, I think that it's so critical to understand what you're able to do, what you're not able to do. And really a lot of that is dictated by statute and regulations and the interpretation of that. So I'm in close contact with lawyers every day because they help me understand what we can do and how we can go about doing that to really protect public health.
Okay, thank you. And I'll just ask one more question. Where we are right now in the pandemic, we're seeing Omicron wane, fewer hospitalizations at this point. I think it's safe to say that we've seen variants come every 4 to 6 months. So as much as we want to hopefully put this in the rearview mirror, and we have a high vaccination rate here, what are you seeing in the future? I guess what if you were to use a crystal ball? It's hard to say, obviously, but what would you think is we're likely to see based on trends? Do you think that obviously there's going to be more variants? And do you agree with the 4 to 6 months? We do see new variants, and I guess just kind of trying to look into the future a little bit.
Yeah, and I would say first and foremost that whatever I say and whatever crystal ball I'm looking into is with the utmost humility that this virus has its own set of priorities and method of operating. And so what I would say in general is that I do feel hopeful that this virus will transition to being more of a seasonal virus that we see when we see other respiratory viruses. Last summer, the Delta variant came at a time when because we're highly vaccinated, we did not see the same type of surge that we did in other areas of the country, but it did come earlier than I was hoping. I thought that we would maybe make it through the summer before we had, a fall and winter surge like we were anticipating. Having said that, now between the Omicron variant, vaccination, and boosters, there are very few people left in the state who haven't had some exposure to this virus or vaccine. And because of that, I'm hopeful that we will have a period of reprieve. I think I'm not totally unjustified to have that hope, but I can't say for sure that that's what's going to happen. And my goal and hope would be that between now and, the early fall, we have time to regroup, to plan, to be ready for a surge that likely will happen in the fall and winter, but hopefully not to the level that we've seen over these last 2 years. And if that is the case, then we will have some time to be able to get all our ducks in order and for people to understand and be prepared for seasonal variation. And understand that there are times when, as it gets colder, you put the heat up. Well, maybe as you put the heat up, you take out more mitigation strategies for all respiratory viruses, quite frankly. And it'll help for other ones that circulate in our community, like flu and RSV and many others. And so I do think that your idea that you have put forward is accurate. 4 to 6 months in terms of variants, very possible. But again, what the impact of those variants might be here remains to be seen.
Yeah, I agree with that. We just don't know, but we have to be prepared. I like your idea. When you turn up the heat, that's maybe when you take the mitigation measures out, because I think that's so far what we've seen at this point. And so I want to thank you again for your leadership during this very difficult time and head into, this pandemic and to the being a commissioner. It is not easy, and you've handled it with great leadership and grace and humility. So thank you for that on my behalf, and I know on so many others as well. Mr. Chairman, do you have any comments or questions?
I do. Thank you, Mr. Chairman. Good morning, Commissioner. Good to see you. And I'll echo the chairman's comments. Thank you so much for your work over these long months and on this incredible, unprecedented times. We certainly thank you and thank your staff for all the hard work that you've done. So just a couple of quick questions. And you mentioned this in your public testimony as well as your written testimony, the word health equity. I'm wondering if you could just expand a little bit on your thoughts on where the state is currently on health equity and where we can do better.
Yes, thank you for that question. So first of all, I would say that the COVID-19 pandemic, as you all know, has uncovered many of the health disparities that we have, and we know that there's a lot of work to do there. What I would say is I'm very proud of our team at DPH, our vaccine equity team that has been led by Deputy Commissioner Aaron and David Reyes. And we've seen the work that they've done with our vans that have been going out into communities, getting people, mostly often brown and Black community members, vaccinated. And what we've seen from our data is that 60% or more of vaccines in Black and brown communities have been administered through these vans. And so it's been so important for us to bring vaccines into the community, to where people live and where they work. And, I've had people tell me, I was speaking with Representative Johanna Hayes yesterday, and she was telling me how she's gone into the grocery store and seen ambassadors talking to people about vaccines and, having people who live in the community, work in the community, speak languages of people in the community. This has been the way that we've been able to get people vaccinated in Connecticut. I could not be more proud of the work that was started before I came, but that has been continuing under the time that I've been here as well. What I would like to see going forward is that we can translate similar models to other things that we do in DPH. And there's so many programs that we do within DPH where there is a presence in the community. So for example, if we're looking at heart health, and particularly in women in Black and brown communities, and where there may be disproportionate rates of hypertension, diabetes, and obesity sometimes too. And some of the different programs that we have, the Wise Woman program, for example, to get women into programs that can help them better their lifestyle choices and food choices and things like that. And that group has done incredible work at connecting with people that really often are overlooked. And I think we need to continue that type of work. Under SB1, we have a proposal that's been out there at ways that we can bolster workforce development, particularly with an equity lens. And I look forward to advancing that type of work so that we can continue to bring people into the workforce who look like the people they're caring for. Again, so important for people to make that connection with somebody and say that I trust you because you look like me. And, I know that Deputy Commissioner Aaron was recently on a trip doing vaccines in the community, and there was an older Black woman who had not been vaccinated, and she talked to her, and she actually decided to get vaccinated. Our team went and picked her up, brought her to the vaccine site for her first one, and she's going to go back for the second one. That's the type of work that is just invaluable. And we need more work like that. So we've made headways, but we have more work to do.
I couldn't agree with you more, especially on the ambassador side, where I have constituents here in the city of Hartford who aren't necessarily going to trust me more than they're going to trust their barber or the bodega owner who they frequent on a daily basis. So seeing those ambassadors in those locations have been instrumental here in the city of Hartford. So appreciate the work that your department has done on ensuring that exactly what you said, that these ambassadors look like us, they speak like us, and they're very much trusted here in the community. So thank you for that. One question I had, we had the Commissioner of Education here on Tuesday, and we focused a little bit on the increase in mental health in children over obviously the last 2 years. I guess my question centered more around the relationship between your department, the Department of Children, of Education, and we'll have Commissioner Navarrete here later on. So curious how all the departments work together, specifically centered around mental health in our children.
Yeah, so this is a great point, and I really commend all of you for making mental health sort of a focus of what many of you are looking at now. I see this as one of the consequences of the pandemic for adults too, but we're seeing it most critically for children, especially with the crunch on beds that we have in our state. And so one thing is that under Senior Advisor and Commissioner Gifford's guidance, we as Health and Human Service agencies get together regularly. We've been addressing this issue of behavioral health for months. The second week I was on the job, we had a problem with too many kids in CCMC's emergency department. We helped CHA get an incident command center set up, which they have been running, but we have been monitoring the number of children. We've been collecting data on the number of children in emergency departments throughout our state, working with the various hospitals to help throughput in terms of those children. All the agencies have been working to get more beds online, and 17 more, particularly adolescent beds for children, have been opened over the months that I've been here, not through my work alone. This is, all the departments working with the various hospitals in the system. And I think that there's more work to do in this regard, whether it be regarding, facilitating licensure, getting more people to be able to work in our system, being able to help that throughput when we do have too many children who are in emergency departments at any given time. This is where particularly DSS, DCF, and we've all been working very closely together on all of these, but including, like you said, Commissioner Navarrete, for the adults. And I think in terms of for education, one of the biggest ways I think that we as DPH can assist there is our model of school-based health centers, which is a very effective model in many of our different cities and schools throughout the state. And we had a group that recently did a more in-depth investigation on this, came up with recommendations on additional schools that could benefit from having school-based health centers. We have some funding that we can help facilitate that type of programming to happen. And that's where I see us being able to really work with SDE in being able to roll out these measures that I think can often help avert crises ending up with children in emergency departments. If they can be, stopped, mitigated in the school before 911 is called or before a child is sent to an emergency department, I think that can go a long way. So those are the types of ways that we are all working together on this topic, literally on a daily basis.
And I appreciate that as CCMCs in my district. So I know how busy they've been over the last 2 years. So the more we can do to prevent them going to the emergency room, I think the better we'll be off. My last question is just curious on the relationship and the communication you have with our neighboring states and your colleagues there, and how do you share data points, trends, all that stuff, and how that makes how that changes any policy that you might come out of your office.
So we do regularly communicate. So we have sort of facilitated communication through ASTHO, which is the Association of State and Territorial Health Officials. And we have a weekly meeting that many of us attend. But in addition to that, most recently, Massachusetts, New York, New Jersey, myself, we all got together to discuss the issues we were all facing with right now. And the good thing is we all know how to reach each other very quickly, can stand up meetings quite quickly. And we've all been able to discuss, what has worked in one state, what are we all seeing, what are the challenges we're facing. And I think it's been really important for us in Connecticut. Of course, you all know this before I came into this position, and I knew it as a physician, seeing it, starting what happened in New York, moving up the I-95 corridor, and Connecticut is usually a couple weeks behind whatever happens in New York. And we all know that now. So we look very closely at what's going on around us and work very closely together.
That's great. Commissioner, thank you so much. Congratulations on your nomination. Look forward to supporting it.
Thank you.
Thank you, Mr. Chairman.
Thank you, sir. Appreciate it. Representative Kennedy, any questions?
Thank you, Mr. Chairman. And again, welcome, Dr. Tutani, our commissioner. It's great to have you here. We're also very fortunate that in this pandemic, we had a medical doctor such as you with your background come into the role as our Commissioner of Public Health. But beside the COVID, which I'm sure my colleagues will be asking lots of questions as well, the role also of the Commissioner of Public Health is to contract facilities and services. And you'd mentioned your team is obviously much larger than what you were used to when you were at Yale. How you started to address it, could you give me a little bit more on how the administrative end of it will go for you?
Yes, absolutely. And, I've been thrown into that right away. I think practitioner licensing, unfortunately, in the first week that I was on the job, we had to suspend a license of a physician. And, since then, there have been many situations that I have been in already regarding facility licensing and workflow throughput. We've worked very closely with the hospitals and with nursing homes in the state. So as an example, when the Omicron wave started to take off, we, through CHA, were meeting with the hospital CEOs twice a week to discuss how we could help with workforce, how we could help in other ways. We were able to bring in FEMA support to be able to have physicians and respiratory therapists and nurses help some of the hospitals in being able to provide that support. We have been able to provide EMS support through federal government support. At the licensing level, as you mentioned, the nursing homes, like I said, I never knew that my experience in nursing homes would prove to be so informative. And again, now I'm not operating as an investigator, but as a regulator. And I've learned a lot of our regulations. And luckily, I have an incredible team, which has made this job a lot easier. Working with Chief of Staff, Lita Orafici, Barbara Cass, who many of you know, and her entire department has been wonderful, because having experienced people and then having, like I said, lawyers who I can rely on to be able to help me understand what is our regulatory authority and what are the steps we take when something comes up. It's really a team effort. So, as I've tried to express, I have humility on what I know and what I don't know, but I do believe that I have the leadership skills to listen to people when there is a new question that comes up so that I can address it in real time. And that's what we've been effectively able to do so far.
Thank you so much, Commissioner. And Mr. Chairman, if you will, just one small question, and I just have to ask this. You've been amazing through all of this, and we really appreciate it. But just for my own clarification, so in 2009, we had swine '09, as it was dubbed by one of my high schools. That so that H1N1, most people don't realize nearly 500,000 people died from that virus. So just clarify for me the difference. What is the difference between a variant, a strain? Are those words interchangeable? Because we're all over the map sometimes with stuff. When we have flus, we get a flu shot, and then it's like you get the flu, and then it's. But that wasn't the strain it was. But now we call it variants. Are those words interchangeable? If you could just help me to understand that. Thank you.
Sure. And it is confusing, and it's a little bit of scientific lingo, a little bit, and it really has to do with the degree of shift or change that happens in the virus and the way that then it manifests in communities. I think really, so it is a little bit confusing. Is it a variant? Is it a strain? What is the difference? I think the main thing for us to remember is that it is change that is happening in any virus. And we have to adapt to that change. And when that happens, whether it is there a certain amount of immunity that whatever previous infection or vaccine that we have received is going to afford? Or is it that we need a new vaccine to be able to deal with that? And how much mitigation do we need to put in place to be able to manage that? I think that's in broad strokes what people need to really remember as we go forward.
I appreciate that clarification. Thank you for your time. And
Thank
Mr. Chairman, thank you very much. It's early still.
Thank you, Representative. Next is Representative Quinn.
Sorry, you're on mute, sir.
Yeah, Representative Quinn, yeah. You are on mute.
Sorry, the space bar didn't work like it normally does. Good to see you again, Commissioner. Just quickly, what do you think is the biggest lesson we've learned out of this whole pandemic from a public health standpoint?
I think the biggest lesson is that we need to have humility about what we know and what we don't know. And as best we can, we need to communicate to the public first. We need to communicate as clearly as we can. And we need to do it with honesty, but also recognize this is what we know with the science where it is right now. And, I think one of the things that's not a very sticky message. I think it's a difficult one to communicate. People want clarity on what's going on. You're the doctor, you're the infectious disease specialist. You're supposed to know. We just got introduced to the virus yesterday, and we're trying to figure it out too. That is what we've tried to communicate the best we can. And we're seeing as this goes on that we learn more about science and we learn about what we know and what we don't know. Having said that, what we try to communicate is that we do have a lifetime of experience that does inform the decisions that we make, and that there are patterns. And I think what I've seen in our community is, I hear people talking about PCR tests and antigen tests and quarantine and isolation, and people are throwing these terms around and they know what they mean by and large. And our society didn't know any of that. So we're working with a much more educated populace than we were before. But I do think if we approach anything new that comes with, this is the best information we have right now, and we're advising this right now based on what we know, but that may change because we may get more information as we accumulate that information.
Thank you. And again, thank you for the work that you've done so far, and looking forward to working with you in the future.
Thank you.
Mr. Chairman.
Thank you. Sorry, I don't want to be on mute myself. Thank you very much. Representative Iaccarino, followed by Senator Moore, followed by Representative Perillo.
Thank you, Mr. Chair. Good morning, Doctor and Commissioner. Just a couple of questions. I'm a keen interest in science and data. And as U.S. Public Health Commissioner, have you looked at the data? I'm a good friend with a doctor from the Mayo Clinic. And she was telling me last summer with the Delta variant, they knew through data and science that it was going to spiral into a worse, the numbers would go up. Now they're looking at the last 3 months, the numbers of Omicron, and the data shows that it's actually the downswing to a good point for public. And as you know, all viruses mutate. They fight to stay alive. They fight to continue. Do you work in your agency work with, say, the Mayo Clinic, of course, the CDC, I'm sure you work with, but look at the actual long-term, there is some long-term science that you have to look at, some short-term unknowns. So the question is, I'm sure you look at that and get the metrics and bring it back to the proper, to the public, to your agency.
Yes, absolutely. So, I think a few things I would say on this. So first of all, we do very much so pay attention to what academia produces in terms of science and what the CDC produces in terms of science. And we generally, as a health department, do collaborate with the CDC to generate more science. So just sort of structurally, the CDC is sort of the research arm, the scientific arm, and they provide us a lot of times with that information, which we can then implement and help create policy and create strategy for how we translate that scientific knowledge into how things are conducted in a given state to be able to help public health and the safety of people in the state. So although we do some science ourselves, most of it is coming from other places and we participate in science. But we absolutely look to and depend on scientific members in other communities to be able to then help guide our decision making. And the CDC is the largest one that we look at, but the CDC, in addition with other academics in the community, is what we do. And I would just reiterate what you said, which is that all the trajectory and data suggest that Omicron is waning. It was a steep up and it's a steep down. Our numbers in the hospital are coming down as well, a little bit slower in this last stretch, I think, because some of the people who are still there were some of the very sick ones, and it just takes longer for people who are really sick to get out of the hospital. So I agree with the assessment of what you said.
No, it's a different, science is changing so rapidly, and I'm sure you have a difficult job. When you first came in, since you've come in, let me rephrase this. Prior to you, the nursing homes were the biggest problem in our state and in the country. Going forward, is there a mitigation plan or like a communication plan? Because I've heard it from so many people that are their family members are in nursing homes. They just, unfortunately, I don't think they do a good enough job. Is there anything that your agency could do to bolster their better care or more transparency?
So, I think one of the things we've seen in this pandemic, and I'm happy to share some data and slides with you that we do have from our own department, is that, unfortunately in long-term care, there are great facilities, there are those that aren't as good, and there are those in the middle. But what I would say overall is the industry as a whole has done an incredible job, actually, in terms of where they started with COVID and care of patients in the nursing home and where they have come. And actually, when we look at data on the incidence of COVID in congregate settings versus in the general public, relative to the two populations, congregate settings, particularly nursing homes, have done better than the general public. And it is because of all these other mitigation strategies that we have that nursing homes have been done so well, whether it be masking and distancing and testing that they've done on a regular basis. And more recently, we did give tests to nursing homes to be able to help prevent the introduction of the virus to the nursing home setting. So I actually think nursing homes and the entire strategy, we have a toolkit for them to be able to utilize that has done incredibly well over the Delta variant and the Omicron variant relative to the general population and relative to what happened before. We also have a very robust network of infection control nurses that help educate nurses and providers in the nursing home setting. So although we provide a regulatory function, we also provide an educational function. And we have CDC funding to be able to do just that. I'm very proud of that team, actually, that has done incredible work to really help mitigate COVID in the nursing home setting.
Thank you. Just a couple more questions. I asked the Commissioner of Education, Tuesday, Massachusetts under Governor Baker, they had to screen and test or test and stay rather, for the school kids. Will you, right now the numbers are down and hopefully they stay down, but if, God forbid, the numbers started going up, is there something, a program or a plan you're going to work with the governor's office, State Department of Education, and your office for school kids to screen and stay or test and stay?
Yeah, so, when we implemented Screen and Stay, which we were, one of a few states in the country that did this in the fall, it was predicated on masking that was there, full time. And so now, we're in a little bit of a different situation, but we're also in a different situation in the pandemic. And we will work very closely with our STE colleagues. And, there are a number of different strategies that we can use. As you suggested, one of the things that we have contemplated is, whether, daily COVID testing at home is something that could be done, and, kids still go in school. Those are the types of things that we will continue to evaluate as this transition occurs. And every school is going to be a little bit different based on their vaccination rates and based on what their school boards decide. But we are very much here. We're not going anywhere. We will continue to advise SDE and school boards and districts on how to best manage any subsequent surges that happen.
Thank you. And then two more questions. It's so ironic or eerie how this pandemic is so similar to 1918 Spanish flu. After the third year, the weekend, generally that's the virus is due. Hopefully that stays here. Is it crazy to go back 100 plus years to look at any of the metrics from then till now, or is that a crazy thought?
I think from 100 plus years ago, they didn't have metrics quite like we have been utilizing, for the last 2 years. But I do think a model of looking at hospitalizations is really where we're headed. I think that is a model. What is the burden of the disease on your healthcare system and on your populace? That is where we are headed. And so I think that is a similar parallel. There's so many things we do now, like screen every patient for COVID when they're coming into the hospital. That's not the type of thing that would have happened 100 years ago. And so it is a little bit of a different situation, but the parallel you draw, I do think is a good one, which is that in general, pandemics in human history have lasted around 2 years, respiratory pandemics. So I'm hopeful that maybe we will see the same, but we have never had a coronavirus pandemic before. So this is uncharted territory. And we do need to stay vigilant and see what happens. But I remain hopeful that we will follow a similar trajectory.
Well, I think the key word is vigilant, preparation, prepare. One last question, and thank you for the time, Commissioner and the chairs. As your role as a Commissioner of Public Health, there's so many other issues. We talked about mental health, and that's a serious problem, not just for students, but for everybody. I think it's really got much worse over the last 2 or 3 years. Is there anything your agency will do for either education, work with agencies, school districts, Department of Public Health districts, or just the public in general? I mean, there's got to be some mitigation. I've always advocated, I don't think we don't have enough, we don't have enough beds, we don't have enough services. I've been saying this since I've been elected and before I've been elected, and that's a serious problem in our state and really in our country.
Yes, I totally agree. And, again, this is one of these things that I've learned as I come into this job is, statutorily, DPH really oversees licensing. We oversee diversion policy when there are too many people in an emergency department. And that is our, technical oversight when it comes to behavioral health. Having said that, this is a public health issue. And, I remain a colleague to all my colleagues. And we, like I said, we've been working very closely as a group of commissioners to address this particular topic. To your point, the other topics I would suggest that, again, have been a consequence in part because of this pandemic. If we look at the opioid crisis, that overlays with behavioral health as well. And I work closely with Commissioner Navarrete on that as well. And that is something where DPH has some authority as well as an agency. Gun violence, again, that's an area where we have some oversight. There are so many things that potentially have been implicated as a consequence of this pandemic that we need to address as we move out of this.
Well, I appreciate your time and thank you, Mr. Chair, and thank you.
Thank you.
Wish you the best.
Thank you.
Thank you, Representative Senator Moore, followed by Representative Perillo.
Thank you. First of all, I want to say I really do appreciate the work that you've done stepping into this job. I can't imagine what it was like for you to step into government after leaving academia and such a different world. I heard you talk earlier about organizational charts. It's a wonderful thing to try to figure out in this big system of things. So I salute you. I don't know anybody who's stronger than you were during this pandemic to say, yes, I'll do this. I don't know if you knew what you were stepping into, but you did a great job. You know, I appreciate you stepping up. So you did a little bit of a segue for me. You mentioned gun violence. And for the last 5 years or so, I live in Bridgeport, so I've witnessed a lot of it for a very long time, not just recent events, but over my lifetime, I've seen it play out over and over again here. And we always seem to put a Band-Aid on it. And so we have an advisory who made some recommendations for our commission to oversee gun violence in the whole state and to oversee grants and evaluate programs, figure out what works and what doesn't. But one of the things that happened yesterday, we had a roundtable discussion with just youth from Hartford, Bridgeport, New Haven, who are on the ground, who see it every day. A young lady, 20 years old, has lost already 4 or 5 friends, not including her family members, just 4 or 5 friends. And I was so impressed. One was 20 and the other was 21. And the first thing that they started to talk about was the trauma, you know, the trauma as a result of the shootings that are taking place in the community, people witnessing these things happening in their neighborhoods, children being exposed to gun violence, watching parents die, family members die, but also being in the midst of gun violence and gunfire. We did have an incident where there was a lot of children playing in a baseball field and there was gunfire. Nobody got hurt, but all the kids scrambled, right? So they took these children someplace to get them calmed down and get them safe, but there's no follow-up for them, right? You don't have to get shot. You don't have to be the receiver of a bullet to know how much it hurts. That's physical pain that can be healed. But the mental anguish that goes along with gunfire, people being shot. I'm interested in knowing, do you have a plan or a concept of what you think you can do to help address the trauma that is a result of much of the gun violence that we see in Connecticut?
This is such a troubling topic, and I think you raised such an important point because there are so many survivors and observers of gun violence who may not actually be the recipient of the actual bullet, and yet the damage that is done is far beyond what we can even really conceptualize, I think. You've summarized it quite nicely in terms of people that you've heard who've experienced it. What I can say is that we do have an injury prevention group in DPH who is very focused on this. And I commend the governor and the plan that's been put forward to be able to bolster some of this work within DPH. And I think you raise an important point, which is not just the gun violence itself, but what are the secondary unintended consequences of that violence? And how do we look at that a little bit more broadly? And I think the first step is recognizing what an important point and topic this is and put the money towards it to be able to try to engage in prevention more holistically and pay attention to those people who are suffering the consequences of it and yet might not be the actual person who's shot, as you mentioned. And I think when you look at it at a community level, and you think about the community pain that might be going on and suffering that goes, you could think about interventions that could be done more in that community mindset so that you capture as many people who are experiencing the effects of this. So I think that we got to start somewhere. There's some work that's been done, but the governor's bill and other things that are being proposed are things that I think set us in the right direction and allow DPH to be able to play even more in that field so that we can take an active role in addressing this very important problem.
So it was interesting, as I said, they were very young, 2021, and they talked about complex PTSD, and that I'm talking to 20-year-olds who are not in the health field, who understand the trauma. One of the things that they recommended is more not emergency, a ban coming in, but sustaining some type of physical presence in these communities that are hardest hit, that people have a place to go, someone that they relate to that's not hospital. Because we had a larger conversation about going up to the hospital and the perception that you're going to the mental health place, and then people say, oh, I saw her at the mental health. But having something in the community where people can relate to that's available, not just when there's a shooting, but sustained, because if we're going to continue to be reactive. Do you see anything in the way of community-based mental health trauma happening in any of our cities?
So, I think this is actually a place, it wouldn't necessarily address a 20-year-old, but our community-based health, school-based health centers, where we want to expand mental health. I think this is an important topic that you're bringing up, and that's one place where it could be done. But I think we do need to continue to partner with community-based organizations, whether it be FQHCs as well. But I think you bring up a really important point. I think these are the types of topics and comments that we need to be able to bring to the table in the discussion on how we can really have a sustained presence and response to this problem as opposed to a reactionary one. We see this in public health all the time. When there's a crisis, Ebola comes, you get a whole lot of money. You get, COVID, you get money. You get, Zika, you get money, and then it goes away. People think the problem's solved. In many ways, the same is true for the chronic problem of gun violence that we've got in our state. And so I think thinking of it in a similar way and having that sustained presence may be able to help people make it through these challenging situations.
Well, I hope that we would look at giving more funds to school. All schools do not have a school-based health center, right? So that we would look at how do we help these children that are in school, right?
Yeah.
But also the federally qualified health centers, that they have enough trained staff to be able to step in to help, and that they're not stretched so thin that they're dealing with the physical presence of people instead of the mental health. So I hope that we'll see more intentional work done around our children to help them, because what's happening in our community all over the state is a lot of these kids are acting out and they don't even know why they're acting out. People are complaining about them stealing cars. What has their life been like in their homes and in the street that they have nothing else, or they're acting out the trauma of the past and they don't even recognize where this is coming from? Because if you ask some of these kids, why are they stealing cars? Why are they doing some of the things that they do? They can't even tell you why.
Yeah.
They couldn't even explain to you what that is. And then I just have one more on Black maternal health. Do you have some ideas of what to do to amplify the voice of that problem, with the mortality rate being higher for Black women than white and Hispanics?
Yes, and this is something that I'm focused on as well, looking into it even further in these months that I've come into this job. So first of all, we do have the MMRC, who does a report on a regular basis, so that we can look at what are the intervenable areas that we can look into to be able to prevent this type of situation from happening. And what I've seen is that a lot of it, again, does rest on this interface with mental health. I think that there are certain screens we do when patients leave the hospital, but that does not mean that that's going to hold true for the entire 6 weeks postpartum. I think that there are some ideas that a number of us in the Health and Human Service agencies have been looking at. So for example, whether it's universal home visiting, community health workers, where there's a presence with some of these patients during a very stressful time after you've had a baby. And depending on your life circumstances, where you can really potentially intervene. And I think this is the reason why we look at these types of ideas, because I do think this is a significant problem. There's clearly a bias where Black women are more susceptible to this. And we do have a report that came out this year. I look forward to seeing how much of that we can move forward with implementing and being able to actually move the needle a little bit so that we can make a dent in this important problem.
Does that report include doulas?
So doulas are something that we are looking at very closely in terms of scope of practice and expanding that. And I think that could be a very important intervention that we do. I'm very supportive of that.
Well, I want to thank you, and I look forward to working with you and assisting in any way that I can. So thank you. Thank you for your responses also.
Thank you, Senator Moore.
Mr. Chair.
Thanks, Senator Moore. Thank you for your forum yesterday. I thought that was very insightful and valuable, and a lot of people should watch that, especially as so many of our youth were speaking up yesterday. Representative Perillo, followed by Senator Kushner.
Senator, thanks very much. I appreciate it. Good morning, Commissioner. How are you?
Good morning. Thank you.
And congratulations on your official moving forward in the process. And thanks for taking time out to speak with us. I appreciate that. Just a few questions, if I could. One sort of, I think, is timely. Around 6 o'clock last night, your agency released a memo explaining basically the go forward plan on masks after February 28th. I found it a little bit difficult to follow. I know a lot of my colleagues did as well, and I got questions from folks in the healthcare community who couldn't quite follow it either. Could you just, there were two bullets there, one about schools and one about healthcare facilities. The healthcare facility component was pretty clear to me that masks are required. Not so much clarity in terms of what the agency's guidance is for, not guidance, but direction is for schools. So could you just clarify that? And it's,
Sure.
And just as an aside, it's kind of tough to get answers, especially when something comes out at 6 p.m.
Sure.
And I know there've been some changes in terms of the legislative liaison staff there, so it's a little bit difficult for us to get those answers. So I'm here. You're the commissioner. So
Yes, absolutely. So just a couple things to your point. I appreciate that. We did want to get this out because it obviously goes into effect on Monday. So I wanted to get it out there, and I am more than happy to clarify. Secondly, just so you all know, Bree has left DPH. We have Miriam Miller and Jill Kennedy who are functioning in these roles. So you can feel free to reach out to them going forward. That's who you should while we're recruiting somebody else to this role. So I want to just read, excerpts of what this order is to clarify. So, regardless of vaccination status, somebody shall wear a face covering mask inside pre-K through 12 public or non-public school buildings if a local or regional board of education or similar body governing a non-public school or schools requires the use of appropriate face covering mask. So to be clear, only if, big if, a regional or local board of education or other type body mandates it is when it's required. So I hope that clarifies what the statement is.
it does, and that's how I read it. Granted, it took me a couple times, but that was the conclusion I came to. And in talking with colleagues, we all sort of felt the same way as well. But I appreciate you officially here on the record making that clarification. A few more questions, like I said, if I could. The issue of hospital mergers and acquisitions and integration both vertically and horizontally is something we hear a lot about. It's been in the news recently. We've had lawsuits from multiple hospital systems. What is your opinion? And I am mindful of the fact that your former employer is one of the the systems that I'm talking about. But what is your opinion as to the impact that those mergers have on access and affordability and quality?
So a few things. First of all, I was employed by Yale University, not Yale New Haven Hospital. So they are two financially separate institutions. I did practice at Yale New Haven Hospital, just to clarify. So I think that, it's a challenging question. I think that where DPH stands is really in the realm of quality and safety. And that is what our number one, that's what we regulate. That's where our statutory authority is. And that's what we will continue to do. And that is what my number one priority is going to be, is that we have enough quality of care and working with OHS in terms of access to care, that is, a little bit outside of DPH, but really healthcare quality and safety is where DPH really lands. And that is what I will continue to do in my role as commissioner. I think that some of the litigation and other questions that come up, really, that is at the level of the AG. So it's a little bit above my pay grade, but I will continue to advocate for patient healthcare quality and safety, because it is incredibly important that our patients in the state of Connecticut have access to care and have quality of care.
No, and I can appreciate that. It's just, as you know, it's something we hear a lot about, and there are always a lot of concerns about, ensuring quality and safety, to your point, and then of course access. And I can understand why, that's even though OHS falls within your realm, it is a little bit of a different entity, and I can appreciate that. It's a concern, and I'm glad you addressed it for me. Another thing that we, I think back to my days when I was ranking on the Public Health Committee, Representative Betsy Ritter, then Representative Ritter at the time, worked together with me to try and address the constant issue of scope of practice. At the time, we were getting bombarded every year with new requests for expanded scope, requests to shrink scope, and quite frankly, a committee of legislators, many of whom did not have medical expertise, was asked to make very political decisions that had very medical consequences. And in so doing, we created the scope review process that falls, of course, within DPH. And I set that background because I was looking at recent Public Health Committee activity, and there is a proposal before the committee to move forward with expanding scope for APRNs to perform abortions. I don't want to get into a discussion on the merits of that, whether that's not the point of my question. But that's something that didn't go through the scope review process. So I just wanted to get your opinion on whether or not you believe the legislature should be acting on proposals to change scope that have not gone through the established statutory process that occurs within your agency.
So thank you for that. Thank you for giving me the background, because I'm learning, more about the background of all of these different things. And I think what it sounds like you worked on very hard in terms of scope review practice is a very important and critical part of whatever happens. And I think that it's set up for a reason. And I think that we should be appropriately looking at scope of any profession as we consider different changes. So I think it's an important part of what happens, and I've seen it have good impact so far. That has been my experience, that doing a proper scope review does yield benefits to doing that.
I agree 100%. Got a little vested interest in it, but but just to drill down and to kind of get a clearer answer, this particular proposal is before the committee right now. It did not go through the review process. Should the Public Health Committee, should the legislature, in your opinion, be supporting changes in scope that did not go through the review process?
So I haven't seen anything in writing, so I don't know exactly what has been said. So I'm reluctant to comment specifically on what's before them, because I have not seen anything in writing to be able to comment on that. What I can say in broad strokes is that I am supportive of the idea of offering safe medical care to women as broadly as possible. And I am supportive of that, but I also am supportive of the idea that scope review is necessary. So not having seen any language, I don't have any language that I've been asked to review. I would be reluctant to comment further on that.
Okay, and that's fair. I can appreciate your concerns about access. I think it's a concern that we all share. I think part and parcel of that is sort of safe access. And the scope review process is primarily designed to ensure that any care provided, again, whether you agree that the care should be provided or not, that's not the point of my question, but any care provided be done so in a safe manner. And our hope X number of years ago was to make sure that, the legislature were voting on issues after DPH had decided that any change in scope would be safe. And I would, there was a time when we would just not do those bills because they hadn't gone through the process. And I see that not happening like it used to. So maybe I'm just a dinosaur in that regard, and I wish things were the way they were. But I would encourage you and the agency to make a strong stand and assert your authority and assert your expertise when it comes to weighing in on changes in scope. They're hot button topics because there's a lot of money involved. So I would just.
Yeah, I think the only thing I would follow up with is that some of the, what is the legal authority of the legislature in this regard is something I would ask the Attorney General on, in that regard. So I would be interested to see what type of language is being put forward. But I think that's one thing that I would just comment.
Fair. Got it. No, and thank you. Thank you for engaging in the discussion. I appreciate it.
Thank you.
Back in, I want to say the end of 2020, when we were seeing a bit of an increase in cases, there were some comments made, and it was a little bit of a hot button topic for a while. About restaurants and whether or not restaurants should be open or should be closed. At the time, the governor, quite frankly, in my opinion, to his credit, was resisting closures. And at the time, I think it was made fairly clear that you might not have agreed with him on that. And I believe you wrote an open letter requesting that he close restaurants. Would you do that again?
Yes, if we were in that situation, I would. So, remember in December of 2020, November of 2020, when we wrote that letter, it was before Connecticut was vaccinated. It was before a lot of different things had happened. If you're asking me if I were in that situation, would I sign that letter again? I absolutely would. Do I feel that way now? No, I don't. We're in a situation where we have 85% of our population that's eligible that is vaccinated. We're still trying to reach those few who have not chosen to get vaccinated, but we're very fortunate that we live in a state where no matter what side of the aisle you're on, you pretty much understand that vaccination is a good public health measure and intervention to help us move back to a normalcy of life the best we can. And so what I would say is that it was the right decision at the time, as you know and have outlined, and despite my efforts, the governor chose to keep restaurants open. He chose to have me come on a press conference and express my opinion. And I think we have had a very healthy working relationship. I feel very fortunate to work with somebody who brings differing opinions to the table and listens to them and then makes the best decision that he thinks is necessary for the state. So I am very fortunate to be able to work in an administration and with team members where we can have that kind of dialogue. And it's part of the reason I said yes to this job. And what a credit to him to bring somebody who he met because of a disagreement into this role. So I think that's a credit to him as a leader, to bring in somebody with a difference of opinion. And we can agree to disagree sometimes, but I'm always going to be on the side of public health.
As I would expect. Thank you. Again, let's sort of turn back time to some degree. One would argue, myself included, that our early response in 2020, and again, at a time when not everybody knew exactly what the heck was going on, our early response as it pertained to nursing homes was not adequate. And in fact, at the time, we had some of the nation's highest death rates, much of which was related to nursing homes. I kind of feel as though we learned from that a little bit through 2020 and through 2021. And then I was very surprised that in January, the agency issued not just guidance, but a requirement that nursing homes, I see you shaking your head and I know what you're going to say.
The document says it. The document says it very clearly. But go ahead and ask your question. It's not a requirement.
Okay, so should we call it guidance?
It is
You okay with
guidance.
that?
Yeah.
Okay, we'll call it guidance. That nursing homes would have to accept COVID positive patients once discharged from a hospital. And that I believe at the time, the guidance was that hospitals should notify DPH if there were nursing homes that wouldn't do that. Could you sort of walk me through the mindset on that?
Yes, absolutely. So first of all, let's remember that whatever happens in the community eventually makes its way into the nursing home. That's what we saw happen at the beginning of 2020. Of course, we also know there were PPE shortages. There were so many problems. There was no national stockpile. There were a lot of problems at the beginning of the pandemic. But we in Connecticut learned a lot, and it's been implemented in terms of how nursing homes have been able to manage going forward, and therefore have done so incredibly well in these last two waves. Now, to your point on the guidance document, what we were trying to clarify was that even though 204 of 205 nursing homes in our state had COVID positive patients who were already there, virus brought into the home, and there were positive patients in the home already. So COVID was not brought in by a patient discharged from a hospital. It was brought in by somebody else who gave it to people in the home. What we were trying to clarify is that, first of all, if you have the staffing, if you have a bed to be able to care for a COVID positive patient, that you can accept a patient out of the hospital to be able to help clear a bed for somebody else who needs to go into a bed in the hospital, and that this can be done safely with CDC guidelines and infection control measures, just like they are doing for other COVID positive patients who are already in the home. So we were clarifying what the guidance is from the CDC, how that can be applied to homes in the state. And what we asked both nursing homes and hospitals to tell us is that if you are seeing difficulty in being able to do this, do let us know, because there was a question from many of you on whether we should set up COVID positive nursing homes. And what we were hearing from hospitals in the industry was very mixed. Some felt like it could be helpful. Others felt like we already know how to take care of COVID positive patients. And if we can put most of them on one wing together, that's what we're going to do to make it easy for us. So part of the reason for that request was to get a sense through real numbers that, are we seeing that patients are not able to go somewhere? It would be a significant financial input from the state to be able to set up COVID positive homes. Is that the best use of our dollars? Is that something we want to do? Are they going to be filled, or are we going to set them up and nobody's going to get discharged there? Because and we already have a staffing problem. If you set up a whole home, who are you going to staff it with? So the reason for that request was to be able to get a good sense on, is this a real problem, or are homes who are qualified to take care of these patients, because 204 of 205 were already doing it at any given point in time, that is it really necessary to do that? So that was the major impetus for the guidance document, not a requirement. Anybody could say no to taking a patient. If you have a bed and you have the staff to take care of a patient safely and appropriately, would that be okay to do? And that's what that guidance was outlined to share.
Okay, thank you. And I can appreciate the clarification. I want to stay on the topic though for a second, and I really just want your opinion more than anything else. So as I said, and you can agree or not, it seemed pretty clear from the data that perhaps there may have been some missteps in early 2020 as it pertained to nursing homes. In hindsight, what should Connecticut have done?
I think one of the biggest things early on in the pandemic was, mask mandate, quite frankly. If you look at the curve in the society at large, it really started to come down after the mandate went into effect. I think in long-term care, the PPE shortage was a significant one, and knowing what to wear, how to do it, what to do, we were all learning in real time. And, now as a state, we have a huge stockpile that we manage at DPH. It's going to be rotated to make sure that if something expires, send it out, let it go to people who can use it quickly, and refill. And so we as a state, and the federal government too, is getting better at knowing how to do this. But we as DPH are going to be in a position where we have PPE should something like this happen again. And I think we just hadn't seen something like this in 100 years. And, we were caught off guard. And I think that between a stockpile of PPE, being able to quickly identify what may work, what doesn't, and our population understands, when a virus is coming at a level that is really sounding the alarms for many people in public health and in government, they're going to be listening.
Okay, I can appreciate that, and that's fair. I to be quite honest, I think it goes a little bit beyond just not starting the mask mandate.
I think that
in
was
fairness,
for
you
the-
weren't the commissioner, so I don't want to.
Yeah, I'm just saying at large. I'm saying if we look at our state at large, but in nursing homes in particular, we've done so many infection control things that have really helped educate nursing homes how best to manage such a situation. There's weekly calls, there are people on the ground, there are people that are going in, the availability of PPE, all of these things that have been done, really looking at that difference in death rate, honestly, between the general population and, well, not just death rate, because our nursing homes are our oldest and frailest, but if we look at even incidence rate of COVID, when you look at congregate settings and you see that they're actually not getting it as much as some people in the general public, it just reflects the fact that when you do infection control measures very carefully, you can protect an even vulnerable population, which is, I think, a real success story.
I don't know that I'd call it a success story. I appreciate the sentiment.
Yeah, we can agree to disagree, but I can share you the numbers. It is a remarkable success story, what has happened in nursing homes in Connecticut, starting from 2020, coming to 2022. If you look at the incidence versus death, it really shows how mitigation measures and vaccines are working to protect our most vulnerable.
Well, and I think to that point, I would agree that nursing homes are safer today than they were then, but there was nowhere to go but up. And I think
that's true. No, that's true. And I do, that's true. There's no doubt about that. But we've gone significantly up in terms of where we were. And I think that what happened in 2020, quite frankly, as we said, we saw a virus coming from New York. And, I had a grandmother who was in a nursing home at the end. And I've written about that in the New England Journal. And it was very challenging. It was extremely challenging to have somebody, pass. I was lucky to be able to see her before she did, but it was right during that wave of March through May, and so absolutely, a lot could have been done better, but we've learned from that. We've learned from that, and other families won't have to go through what families like mine did.
Understood. And sadly, I think we all have stories like that.
Yeah.
It's unfortunate. In fact, the word unfortunate doesn't quite do it justice. I actually, when we spoke with the Commissioner of Education on Tuesday, I asked her a question, and I'll ask you the same one. Obviously, a lot of talk in the last few weeks about mask mandates in schools, and the process to make that decision. And quite frankly, I know it wasn't an easy one. But could you give us a little bit of a peek behind the curtain as to what went into that decision, whose input was considered, and what variables were taken into consideration in determining, eventually, obviously what we talked about earlier, which was the memo from last night.
So you mean most specifically this most recent decision, February 28th?
Absolutely correct. Yes.
Right? Yeah. Okay. So, this has been a very collaborative decision, for many weeks going into this. So what I would say is, first of all, we obviously were in close conversation with the governor, with his, closest group of people who work with him, Paul, Josh, Nora as, chief counsel, within DPH, other states, as I mentioned, other health commissioners, New York, New Jersey, Massachusetts, our education colleagues, whether it be our different union groups, superintendents. I think that there are many, many different groups, local health officials who I have connections and relationships with. And there was a lot of discussion on looking at how our numbers were coming down and, the desire to move this really to a local decision, because we have different conditions on the ground in every different area of our state. I've had schools writing to me who are 90, 100% vaccinated, and they don't feel that the same rules should apply to them as other schools, and other schools who may not have the same vaccination rate, but for their own set of reasons, for their populace, feel that they should not have to do certain things. And then other groups who've said, you know what, we polled our parents and they want to keep the masks on. And I've heard that. I've heard all variations on this, every single one. And so, it was really a very collaborative effort. And in the end, we knew that a lot of schools in Connecticut had the President's Day holiday. We knew the 28th was going to be about a week after that. So some washout period from that holiday break period of time. And we wanted to provide tests to schools to be able to allow every student to do an at-home test on the first morning of a mask optional environment if they were going to be going to a school as such. And we are providing those tests in addition to many others we've already provided to districts, so that every student and staff member can walk home with 2 boxes to be able to do such. All they need is one test on the morning of. And so it was a very thought out process with lots of meetings and lots of different outreach to different groups. We tried to take into account as much as we could into the final decision that came out.
There were a lot of folks in our building, and especially in the community, who felt that the mandate probably, could have been, should have been lifted earlier. What were the data points that came into the decision to hold off and wait until February 28th? Very data driven, understandably, as it should be. So what were your triggers and what were your considerations?
So I think there are a few things. Number one, there's some people who would say it should be longer, and there are people who said it should be shorter, right? So both sides, you really, we're not going to win with either of those. We're trying to identify a relatively safe time when people can make this decision and it be a local decision. And I think one of the things we've seen is that a number of the data points we were looking at early in this pandemic were before vaccines, were with the original SARS-CoV-2 variant, not Omicron, which is much more infectious, very transmissible, not as severe, especially when you have a vaccinated and boosted population. And because of all of that, our numbers just don't mean the same thing anymore. Percent positivity when you have, millions of self-tests at home with people right now is a different indicator than it was early in the pandemic. Case rates are a different indicator per 100,000 than they were early in the pandemic, because this particular variant is so highly infectious, but for some people, they just feel a little fatigued and they're better in a couple of days. They all mean different things. But what we can say is that when you have a 24% positivity rate that has gone down to a 3% positivity rate, that is the right trajectory. When you're looking at cases per 100,000 that were 268 and are down to 22, that is the right trajectory. When you're looking at, 1,900 plus patients in the hospital, and you're now looking at 255 patients in the hospital, it's the right trajectory. So all the metrics that we had are going in the right direction. They're continuing to go in the right direction. And that's all what went into this decision-making.
During the debate about whether or not the mandate should be extended, whether it should be, cut earlier, there was a lot of discussion about the impact of masks on social emotional learning. And we've talked about mental health already, but mental health, the mental health of our students. What consideration was given to that in the process? I have to imagine it was considered. Maybe it was just decided that that was not as important as some of the other public health aspects. I just wanted your take on that.
Yeah, so I mean, I think that it's a very important consequence of this pandemic. I think it is unclear how much the actual mask has resulted in what we are seeing in terms of behavioral health for adolescents and children. It certainly could be a component. I await, further scientific data from people who would be gathering such data to be able to inform that specific question. What we can say is that this pandemic, the isolation, the exposure to social media, the amount of time kids have spent on screens, looking at what other people are doing, what their lives are like, comparing it to their own, feeling what they're left out of, what are they part of? And again, a lot of that being done through screens. They're intense impacts that this pandemic has had on the social and emotional well-being of our young people in this state. And the masks could be a component of that. We will see. I don't anticipate that when the masks go away, our behavioral health problem is going to go away. I don't think anybody thinks that. There are going to be long-standing ramifications of this pandemic that we have to deal with. And we certainly took into account a number of different things as we looked at this decision.
Okay, I think I heard a lot of concern from, I'm sure we all did, from parents and from teachers that, they felt that, the masks were really and are really inhibiting students' ability to learn effectively, especially in the elementary grades. So I can appreciate that. Actually, just one last thing before I forget. Test kits. You had mentioned in a press conference that let me just clarify. When the state was supposed to have received test kits and didn't, you had mentioned that the order was made, the contract was in place, and if I'm misstating, let me know, because I'm just doing this from memory.
Yes.
But you had also stated that, there had been photos of test kits being shipped that turned out not to be accurate. I think one of the roles that the public looks toward the commissioner of DPH for is, you want to be able to trust your DPH commissioner. And, I mean, no offense, but I think I'm trying to be artful in how I phrase this. One could perceive that your statement that there were photographs when indeed there were not might lead to a mistrust of your statements in the future. What are your thoughts on that?
So first of all, I will say that I try to communicate the best I can with the information I have. And you're absolutely right. What we were a team working across DAS, DPH, a number of different agencies, DEMIS, to really secure these tests in a timely fashion. This really started in the week before the holidays, where I was trying to see if we could do something to get tests into our community to be able to prevent people who are infected from going and visiting others over the holidays and over times when they would be gathering with other people. That's how it started. And, we found somebody who was able to provide us with the tests, working with DAS. And as you mentioned, we had a purchase order, a contract agreement that had been signed. No money left the state, as I think you know. And I was told that there were photos of the tests. And this was what I was told, was that whenever they engage in a big purchase like this, they ask for photos to confirm that the tests are what we think they are and that they are arriving. And so in that statement at the warehouse where I spoke after the governor, the press conference that you're mentioning, I did mention that there were photos. I had not seen the photos, obviously, but I mentioned there were photos because I was communicated that whenever we do a big purchase like this, we ask for photos. After the fact, when the press wanted the validation of what I asked for, we provided the purchase order, we provided the contract that was in place, we gave the details, but there was no specific photo. So I certainly did not intend to mislead anybody. I communicated what had been relayed to me, which is that when such a big purchase is done, we ask for photos, which is what I suggested. I had not seen those photos. As you can imagine, it was a multi-agency process that was going through. As commissioner of DPH, there are certain things that I do. I don't do every specific nuance, but I was very involved with making sure a purchase order was in place before anything else happened, working with our fiscal team over the Christmas holiday and the like. So certainly had no intention to mislead anybody. And that is, quite frankly, the truth of what happened.
Okay, I mean, I get it. A lot of moving parts, a lot of people. Ended up probably being a bit of an unforced error, but accidents happen, I understand. Did you just mention, though, that there was a signed contract?
So again, a lot of the DAS language on procurement, I would defer to them, but the purchase order is associated with a type of contract. Now, they have a specific term of a contract, but it's not a contract where you actually send any money to anybody. You need to have a relationship with somebody to be able to issue a purchase order. So that is the terms of what we were referring to, but I would defer you to DAS, who actually executed that particular arrangement.
Okay. I'll leave it at that. No, I appreciate your time, Commissioner. Best of luck.
Thank you very much.
Thank you, Representative. Next is Senator Kushner. I'd just like to remind the committee that Commissioner Giussani has an 11:30 appointment in front of the Appropriations Committee. So we still obviously have to do our due diligence here in executive and legislative nominations, but people can be mindful of her time right now, as it is a little after 11:30. Senator Kushner.
Thank you. I will be very brief, but thank you, Commissioner. I think your answers here today have just absolutely solidified my support for this nomination. You are amazing, and we're very lucky to have you. And
Thank you.
in my interaction in public health with you, which has been very limited so far, but the little bit that I've had also suggests that we've got a great candidate for Commissioner. I do want to just underscore what my colleague, Senator Moore, said about the impact of gun violence and trauma and social and emotional well-being. I can confirm that that's been the case in my community, where we are still suffering after all these years from the impact of Sandy Hook. And it is clearly not something that is easy to deal with, and it is widespread. I recently had dinner with a young woman from middle school, and she told me her biggest fear about going to school is that there will be a shooting incident. And she says she lives that fear. And I didn't solicit this, it just came out, and it was quite emotional for her. So I believe this is a really important issue that we do need to address through your agency. And I would hope that, I like what you said about partnering with other agencies, but the one partner that wasn't mentioned is our universities. And we just are standing up a program at Western Connecticut State University for school safety. And I think that's another very good overlapping area which could be explored to work with you. So thank you for your testimony here today. And I really appreciate the job that you're doing.
Thank you for that, Senator Kushner. I did not mention, I am glad you did, I've established relationships both with CSCU, and the Office of Higher Education. And, we'll continue to explore those. I'm glad to learn about the program you're talking about and very much look forward to continued work in these areas. Thank you.
Thank you.
Thank you, Senator. Representative Godfrey.
Thank you, Mr. Chairman. Congratulations, Commissioner. I'm enjoying your testimony very much. You're kind of wading into the hyperpartisanship that we're seeing nationally over what should be decisions and discussions by healthcare professionals, as you are. So good for you on that. I just quickly wanted to chime in and agree with both Senator Moore and now Senator Kushner. I've been working on gun violence bills for over 30 years, and we've progressed enormously in Connecticut, but there is still this ongoing public health crisis that gun violence brings, not just in the aftermath of a shooting, but with physically repairing a person who's been shot. But also, as especially Senator Moore has talked about, the almost permanent mental health problems that result from being shot, from witnessing a shot, from being in a terrible situation. And I just want to commend you for your interest in moving forward, because the Department of Public Health is going to be so important in making sure that Connecticut continues to be a leading state on gun violence and dealing with it. And the mental health pieces are so important. So I certainly support your nomination. I'm very happy with the governor's moves on gun violence. And I just needed to say that in public and congratulate you and thank you for your interest. You certainly have my support.
Thank you so much for that. I appreciate that.
Thanks, Representative. Senator Kelly, ranking member.
Thank you very much, Senator. I just have more of a comment than anything, particularly with regards to the positions taken on the experiences in the skilled nursing facilities. While we may as a state have been doing much better, the subject population that reside in nursing homes is really paid the ultimate price for the COVID experience. Individuals over 65 have been ravaged by this virus. And so while the general public may have fared much better, I'm afraid the experience, I'm going to differ with the commissioner on this, the experience has not been as good in nursing homes. Even the current data that we have right now demonstrates that almost the infection rate in nursing homes is 5 times that of the general population, and the death rate is 15 times that of the general population. And what has been most disturbing here with regards to the way the administration has handled this situation is we had asked for data on a more current basis. And I'm mindful of what the Department of Public Health's position is, that you were looking for 2-week tranches. But that's not the same data points that we're looking at in the general population. We look at infection rates on a daily basis. We look at death rates on a weekly basis. So for a population that is so vulnerable, where you have a higher infection rate and a higher death rate, we should be getting that information more timely. I think that population deserves that. It demands that. I've asked for this. I have not been given that, nor has the positions changed. Also, the administration's position that COVID existed in nursing homes before, so that it's okay to discharge from hospitals people who are COVID positive. I disagree with that also. You can't continue to contribute to the problem because a problem existed. And it took 2 weeks after that guidance to actually start to then test and monitor visitors to the nursing home facilities. I think more attention needs to be given to this client population. People in nursing homes are the most vulnerable. They're the most chronically complex cases, and we need to change the position on that. We still have to, COVID virus is still present. We still need to be vigilant in that regard. And I would urge the commissioner to change the position with regards to that. Thank you very much, Mr. Chairman. I have no further comment.
Thank you, Senator Kelly, for those comments. As you would suspect, I would agree to disagree on some of your statements. First, I would just say that just to clarify for the record, if we look at the nursing home death rate that we have had during our most recent time period, the death rate was 0.85%. If we look at the number of nursing home COVID death to case ratio, it's about 4%. And the percentage of COVID cases in Connecticut that are among nursing home residents is 1.3%. Yes, this is our most vulnerable population, and we have made incredible strides in being able to help care for this very vulnerable population. What I would say in terms of the reporting of data is that nursing homes are required to report federally to NHSN on a regular basis. And quite frankly, they have been so overwhelmed with the amount of reporting that they need to do, in addition to what we require them to do as a state, that to report on a daily basis, when really what we want them to do is take the best care of these patients, at this point in the pandemic, I do not see as a necessary intervention given where we are. If things were to change, I would be open to that, but to require them to spend time on something that, given our numbers where we are, I do not see as the most useful time that they could spend, I think is what is most important. So, I understand your perspective on this. I would say that the state has done an incredible job in getting to a better place. I do agree that this virus disproportionately affects our oldest adults, whether you live in the community or you are in a skilled nursing facility. There is no doubt that our oldest and those with most comorbidities are most affected by this virus, even with vaccination. So we do need to continue to take care of this group as much as possible.
I agree with that comment that we need to take care of this vulnerable population. Obviously, we're going to disagree on this and agree to disagree. The one concern I do have here is I'm mindful of the obligations and burdens placed on the nursing home industry. They are overwhelmed, but there is a market failure here in the fact that the state's Medicaid reimbursement rate is artificially low and pays only a fraction of the cost of the good work that most of these places do. And I think that contributes. And when we look at this issue, we shouldn't be guided by the dollars or the expense of having, like I heard before, the COVID only facilities, or to say this would be too hard of a burden placed on a reporting requirement. What we need to be guided by when you're dealing with a vulnerable population are the people involved. And that is what we should be guided by, not the dollars, not the burdens of a workload, but by the people that are vulnerable and in harm's way. And that's where I would agree to disagree. I would place the focus on them and spend the money and make sure that they're taken care of and protected. Thank you.
Thank you for that. And I think we agree. As a doctor and as somebody who's taken care of older adults for most of my career, that is my number one objective. And maintaining the public health and safety and appropriate healthcare for our oldest adults and most frail is what I studied and investigated for almost 20 years and what I will continue to do in this role. So we're in agreement there. I'm not DSS commissioner. I do not regulate Medicaid rates, so I won't be able to comment on that, but I will tell you that we do meet as a long-term care group with DSS, with our ombudsman, with our aging and disability group on a weekly basis to do exactly what you've identified. And never have we made a decision because of ease. If anything, I think our nursing home industry would know that we ask them to do quite a lot to be able to help protect the safety of our most frail and vulnerable residents, that we owe them that. Thank you.
Thank you. Thank you, Senator Kelly. Are there any other questions from members. I see Senator Looney there. Not sure if you had a question or not. Hi, Senator.
Hi, Mr. Chairman. How are you? Not quite at this point. Maybe a little later. Yeah.
Okay. Thank you. All right. I don't see any other hands raised by members of the committee. So I think you can get to appropriations. I just have to ask you the one question we ask everybody, Commissioner. Is there anything in your past that you believe might prove to be embarrassing to the committee, to the governor, or the state of Connecticut?
No.
Okay, thank you very much. Have a great day.
Thank you very much, everybody, for the opportunity to speak with all of you. Appreciate the time. Thank you.
Thank you. Thank you. Okay, next we have Dante Bartolomeo of Meriden to be the Labor Commissioner. Hello, Dante, Commissioner.
Hi, sir. How are you?
Hello there. How you doing? Would you please raise your right hand? Do you promise, swear, affirm to tell us the truth, the whole truth, and nothing but the truth?
Yes, sir. I do.
Okay, thank you. Please give your opening statement.
Thank you. So good morning, Senator Duff, Representative Concepcion, Senator Kelly, Representative Kennedy, and members of the Executive and Legislative Nominations Committee. I'm Dante Bartolomeo, and I'm honored to appear before you as Governor Ned Lamont's nominee for Commissioner at Department of Labor. I've been fortunate to have worked with many of you in my past life as a state senator, so you may remember that concise remarks don't come naturally for me, but given that I submitted a detailed testimony, I'll provide the abbreviated version now, and I look forward to your questions. So some quick background. I'm a proud lifelong resident of state of Connecticut. I grew up in Wallingford and I attended Colby College. I came back home where my husband and I raised our children in Meriden. In June, this past June, after serving for 2.5 years as Deputy Commissioner at the Connecticut State Department of Labor, Governor Lamont nominated me as the interim commissioner, and I sit before you now in the hopes that you will confirm my nomination and allow me to continue this important work. I'm very proud to work at CTDOL and with the tireless, dedicated staff in this agency. They are among the most professional, expert, and diligent that I have ever known. Despite the stress that the pandemic has put on their own families, they have done an extraordinary work for the residents of this state. Connecticut's economy was among the hardest hit by the pandemic, and the Connecticut Department of Labor was overwhelmed by unemployment benefit applications beginning in March of 2020. In March and April of 2020, Connecticut lost 292,000 jobs and saw our unemployment rate jump to almost 18%. Over nearly 2 years, 627,000 Connecticut workers filed for 8 federal and state programs that require the agency to stand up new technology and systems and respond to a rapidly changing federal landscape. In total, the agency received more than 1.5 million applications for benefits, more than we usually get over a decade, and dispersed more than $10 billion in unemployment benefits, money that kept the state's economy afloat during the pandemic. COVID was a sharp reminder of how important it is to have 21st century technology and sufficient staffing at safety net agencies. For CTDOL, our main operational issues were related to 40-year-old computer systems, anemic staffing, the project of budget cuts years earlier, and we are working to remedy both of these. Reemploy Connecticut, the state's new unemployment system, will go online on July 5th. It'll allow claimants a more efficient filing experience, improve how employers report financials and other data, and give us a way to extract important data to help identify trends in the labor market and the economy, which I'm sure will be helpful to you as well. For an agency that lost 35% of its staff in budget cuts over the past years, bringing temporary, durational, and permanent staff on board is critical. I continue to work closely with Governor Lamont's team, OPM, and DAS to make hiring a priority. The Consumer Contact Center stood up in July of 2020 has already handled 2.1 million calls and cases. It's imperative that these claims agents continue to be a resource to filers. So with December marking a record-setting 12 consecutive months of job growth, we can point to other signs of progress as well. Connecticut's unemployment rate has dropped to 5.8%. Our weekly filer rate had gone up to a high of nearly 400,000 people a week in May of 2020. We're now at about 32,000. Businesses are adding jobs, and we've regained nearly 75% of the jobs that we lost during the pandemic shutdown. Economic recovery is underway, and Connecticut Department of Labor has focused our efforts on other mandates, expanding our workforce development and training programs. So in a recent survey that we conducted of 100,000 unemployed workers, the top reason that residents had not returned to the labor market included a mismatch between jobs and skills, low compensation, and concerns about COVID risks still. Young women cited a lack of reliable childcare as among the reasons that they hadn't returned to the workforce. So family care, transportation, illness, housing insecurity, and other issues play a major role in workforce participation. And using 2Gen and whole family approach to jobs in programs like our Jobs First Employment Services, we are taking a pragmatic approach to building a strong and a stable workforce pipeline. Through programs like youth employment and registered apprenticeship, we are also bringing young people into the workforce and helping them build careers. So Connecticut Department of Labor administers the state's only federally recognized registered apprenticeship program, with more than 6,700 apprentices registered in nearly 1,700 companies across 50 occupations. This program just recently received a $10 million grant to help us build out apprenticeships that support the healthcare industry. Connecticut is one of only 5 states to receive this full award, and our apprenticeship program is using it to build a career ladder that brings workers up in the healthcare professions, an industry that has an immediate need for workers now, and it will continue to grow in the future. So one last thing I'd like to say before I take your questions. This team at Connecticut Department of Labor has worked tirelessly to serve Connecticut residents. We have met challenge after challenge, working long hours and doing what needs to be done to achieve Connecticut Department of Labor's mission. I really have enormous gratitude for them. And while I can't possibly recognize them all right now, I do need to acknowledge my left and my right hands, Deputy Commissioners Daryl Dudinsky and Mark Pizzella. It's an incredible team, and it would be an honor and a privilege to continue leading them. So thank you very much for your consideration, and I look forward to answering any questions you may have.
Thank you, Commissioner. We appreciate it, and thanks for all your work during the pandemic. Certainly wasn't easy. The only question I have, and I appreciate your testimony is succinct, though detailed, so it gives us a lot of good information to consider. Do you, the Department of Labor was upgrading its system from Cobalt, which had been around for decades, and there was truly a lack of investment over many decades to not help our infrastructure. And then we have a pandemic which totally tested the infrastructure. A lot of folks were working in a manual capacity to try and help move things along as quickly as possible. I know all of us, all legislators on all 4 caucuses were working hard to help their constituents as well. Tell us a little bit about the technology upgrades and where we are now as it relates to how things are moving at this point.
Yes, thank you for that question. A little bit of an echo, hopefully that'll stop. So we are moving right along, and the pandemic did set us back 13 months. We had originally anticipated a go live of May of 2021. It is now scheduled for a very short couple of months till July 5th of this year. And the system itself will replace, as you said, an old Cobalt. We had 5 systems actually put together into one, and that mainframe driver workhorse was, a 40-year-old system. We will now be modernized, cloud-based. We'll have the ability to do a lot more automated. So for instance, you have seen in our system where we would have applications come in and then we had a whole unit that would do an initial claims kind of combining of information from 2 systems. That won't have to happen anymore. It will be much more streamlined. So we're right now in the kind of stages of testing. We're beginning training for our staff on the new system, and we're really excited for July.
Good. Welcome to the 21st century. Cloud-based services. Mr. Chairman, do you have any questions? You're on mute. You're on mute. Representative Concepcion, you're on mute.
Oh my Lord, it's only been 2.5 years of this. You would
Yeah,
think,
we'll get it right one day.
yeah, you would think I'd be prone to it. So, Mr. Chairman, thank you very much. Just two quick questions, Commissioner. First of all, congratulations on your nomination. This is great. One's really asking you just to expand a little bit on something you mentioned, which was the survey of the 100,000 unemployed citizens now, and why they haven't gone back. And I guess my question is, how does DOL work with other departments here in the state to kind of mitigate some of those issues? So whether it's working with DOT on the transportation issues or anything like that. So we have an issue. We have survey results of what that issue is. How do we work together to ensure that, again, we mitigate? Obviously, DOL can't do everything, but there's got to be some partnerships with other departments throughout the state. So just curious how you work with other departments to ensure that we get those individuals back to work.
Yes, thank you very much for that question. So I'll start with the survey. What we did is we had actually come upon a survey that the state of Maine did, and they were, it was at the same time where the work search process had changed and federal benefits had, some of the federal benefits had stopped. And yet there was a thought that all of a sudden, we would see a lot more people going back to work. And we were hearing from employers. I was out at chamber events and hearing from employers that, I still can't find people who are wanting to take these jobs that I have. So we thought, well, we'll do our own study as well. We sent out, it was in December, to 100,000 folks who had been within our system. And we did get responses from 7,100 of those. And we found some things that were interesting and some things that we expected. So one of the questions that wasn't even on there that people wrote in about was this idea that they felt that there was age discrimination. That was something that we had not even contemplated. There were some things that we knew. There was people who felt that there was a mismatch of their skills for the jobs that were available. And I think the thing that stood out to me most is the idea that of the women who had not returned to the job market yet, there was a very high percentage of young women around, under 40 or so, who cited childcare, unreliable childcare as an issue. And that's something that we anecdotally know. And, it's not a scientific study, but we confirmed that. So I've actually been in contact with Commissioner Bai from Office of Early Childhood, also with the Governor's Work Council on Women and Girls, talking about whether or not there's something that we need to be doing to address, the idea of, there's two pieces here. There's the children getting back to childcare, but there's also when they do get back, and I actually have this situation with someone in my office, they're still very often having to quarantine their children. So, I know someone that works for me from November through has almost had her children home more than she's had them there because of quarantine policies. And so it's really hard and unpredictable, especially for women or parents of young children at this point in time. So that's some of, and I'm happy to share and send you out the study. As far as collaboration, I would say that pretty much every agency, we do find different opportunities because workforce is so pervasive throughout. So the Office of Workforce Strategy, we work extremely closely with. The Office of Early Childhood, I said, not just on that initiative, but also on this whole family approach to jobs and a 2-generational initiative through our Jobs First Employment Program. We've teamed up with the Office of Early Childhood and daycare providers to be able to have our participants in the Jobs First Employment Program service get connected with Care for Kids through them. So truly, I think we could probably pick up any agency. Department of Children and Families, we're working together with their population who will be aging out of the the department. And I've got Grow with Google completion certificates and scholarships that I'm able to offer. So I've identified, that agency and that cohort of young potential workers to be able to share those with. So hopefully that answers your question.
It does. Thank you so much for that. And then just my last question is, and not sure if you can answer this, but what is the average, I guess, wait time for someone that applies for unemployment by the time they receive, whether they've been accepted or denied? And then, what are you hoping that wait time? Obviously, you're hoping that it goes down, so what's the expected wait time for someone that applies for unemployment and by the time they receive notification?
So at this point in time, and for the past few months, there really is no kind of wait time to speak of. So it's an application goes into the system, it gets into what we call processing anywhere from 1 to 3 days, and then that's where there's a variety of criteria that would cause it to either be held to be reviewed or to continue on. So, for instance, if somebody has employment in multiple states, if they are military, there's a whole bunch of reasons why we might have to review it. But even that adjudications process we speak about is only at 15 days right now. I monitor that every day.
That's great. Well, thank you so much. Thanks for being here. Looking forward to supporting your nomination. Thank you, Mr. Chair.
Thank you, sir. Next, we have Representative Kennedy, followed by Representative Quinn. Then we'll have Senator Kushner and Senator Moore.
Thank you, Mr. Chairman, and I will be brief. Commissioner, thank you so much for being here, and can't thank you enough for all you've done over this past 2 years. It's just been an arduous task for you and your department. And I too am looking forward to July when the system, your new system, is up and running. I'm sure you learned a lot from it. And my first question does relate to that, this antiquated system. Are you going to have enough employees for your training? You had said you're down 35% over the years. How are you for staffing to learn this new system?
So thank you for that question. We entered the pandemic down 35% from what we had been around 2015 due to layoffs and attrition and that kind of thing. During the pandemic, we were fortunate to have the support of the administration as well as the legislature, and we've been able to use the CARES Act funding to be able to bring on temporary staff as well as durational. There's just a little technical difference right there. So we've had as many as about 350 temporary staff at a time. We continue to have that kind of ebb and flow, and that is primarily, other than a handful of my permanent staff, how we have been running the consumer contact center that we stood up in July. So that has been going quite well. We do have, and hopefully we'll have support of the legislature. The governor's budget does have funding for us to be able to continue the consumer contact center for that very reason. So I don't have the permanent staff to allow that, but we do have resources that hopefully you will approve, and the governor continues to support to keep it moving, keep it going.
Great, thank you very much. And just my final question is, we learned a lot, obviously, from the pandemic. And one of the questions I got a lot was from our seniors. And when I say seniors, they're probably people more like they're older than 60 plus or so, and not as fluent with our computer system. And so how can you best address reaching out to those that don't have computers, or they couldn't apply, so they were really struggling, and working with the public for awareness of the department and how to proceed, especially when they're unfortunately don't have access to computer, even though our libraries can support them. But that was a lot of calls I got were from seniors that were just so frustrated because you couldn't get through on a phone call, and they were always told just use a computer, and they were frustrated by that. If you could just address that.
Yeah, I really do empathize with the position that this has put people in. So what we had done years prior when there wasn't funding to sustain the call center that the agency had, in order to be accessible, we took people who were expert in unemployment insurance and moved them into the 18 American job centers throughout the state, so that when someone had a question or a problem, they could go there. Obviously, within 3 days, I think, of notification, we had to shut those down and had to, we shut off access to our claimants and they had no access to us. I truly empathize. And what we did do and what we continue to do is to make sure that anyone who does call on the phones for the Consumer Contact Center, if they do not have access to a computer, we will make special accommodations for someone to call them. We also, in the American Job Centers, when we were able to open up the 5 comprehensive, we have dedicated multiple staff in the contact center who can go online to a computer. So if you go in, let's say my mom goes into the American Job Center and says, I need to get online for my unemployment, she can go to one of the Career Center computers, and we have a dedicated connection to someone who's in the contact center. So kind of like we are on Zoom, they could interact that way. So that's part of it. The other part is I want to give a shout out to the legislature for the establishment of the Unemployed Workers Advocate Unit. That is something that we are in the process of standing up, and what I expect will be a real positive that comes out of that is that this group of folks will be able to look at systemic issues that may be encountered by people who are not employed, whether they're in the unemployment system or not, and be able to use data and trends to identify what may be systemic issues and to help with our ability to educate the public. So I think that will be a benefit of the office that the legislature created for us.
I think that'll make a lot of people happy. So thank you so very much, Commissioner. And again, thank you so much for all you've done over the last 2 years. It sure has been a tough 2 years. Mr. Chairman, thank you very much.
Thank you, Representative Quinn, followed by Senator Kushner and Senator Moore.
Thank you, Mr. Chairman. Well, Commissioner, who would have ever thought a few years ago that you and I would be sitting here having this conversation in these roles? I know I wouldn't have. Let me just tell you a little bit about the commissioner. I mean, I first met you when you were appointed to fill a vacancy on the city council in Meriden, and she has been an absolute dynamo for the city, both in her roles as a city councilor, then as our state senator, and now as the labor commissioner. And I know that we are all very proud of everything that you've accomplished in the time that you've been involved. Turning to your computer system for a moment, is there going to be better planning put in place so that if, heaven forbid, something like this happens, 15, 20 years down the line, that we don't find ourselves with a system that just isn't up to the task?
Well, first of all, thank you very much, Meriden friend. I do appreciate the kind words. So the system itself we are part of a collaboration of other states. So this system has already been launched. We're part of a consortium in a couple other states. So we have the advantage of kind of learning as they have learned, and making adjustments, as it's coming into our state, into Connecticut. So, I think as far as the system itself, we will be light years ahead of where we were. As far as kind of learning from the pandemic, I think the thing that we have really come out of this is that we can't rely on doing business as we have always done business, right? We can't rely on, that ability to see someone in person. And we have to take into account, as Representative Kennedy said, that not everyone is computer savvy. I think most people do have smartphones, which was helpful to them during this, but that doesn't mean somebody, like members of my family who would be annoyed if I mentioned them specifically would still be able to figure that out. So, I think that that's what came out of it. I think also another thing that came out of this that we are actively working on is unemployment insurance is an extremely, extremely complicated program. And I can't say that enough. And we are also governed by state and federal laws. And so when we review and have been reviewing throughout this, we kind of do the self-assessment, the forms, the applications, the information that's out there, the letters that are sent. We certainly identify, and especially myself coming in, not, before I came to this agency, I knew nothing about unemployment insurance, identify the fact that some of this is not in common language. We call it UI language, and we have UI experts who have grown up in this agency and been here for 35 plus years. And to them, it makes perfect sense. And so we're making those kinds of adjustments and having learned, I think, that from what's been going on and from the pandemic. So we will definitely carry all of those messages through.
Thank you. And then my final question concerns the overpayments. Obviously, some of the overpayments were clearly situations of fraud, but probably most of them were just mistakes and not being familiar with the system and trying to work their way through it. Where are you guys now in dealing with the overpayment issues?
Yes, thank you for that question. So overpayments come in the two forms, right? So there's the fraud overpayments and there's the non-fraud overpayments. And I fully expect that we are only talking about the non-fraud overpayments right now. So where we are is hard to gauge because we don't know there's no finite point visible for us right now. We're not able to identify that finite point. But I can tell you that we have, at this point in time, out of all of the unique number of claims and individuals that we've received, we have about 3.8% of those are non-fraud overpayments. So it's a relatively small number, but it does translate into a very onerous obligation for people. And so I think that for us, what we have been working on through trying to get the message to our federal partners and USDOL and even to Congress is this pandemic, overpayments took on a life of their own that they had not ever, even in times like the Great Recession, after the Great Recession and the unemployment numbers were high. And that was primarily because of this, the acronym is FPUC, the Federal Pandemic Unemployment Compensation. That's the additional $300, $600 that was put on top of, if you got $1, you got the extra $600. And what that means is you've got folks who never applied for that. They didn't apply for the extra $300 or $600, but that's what escalated their overpayments to astronomical levels. So we, within what our ability and our rights and within the law, we have to establish overpayments. We have to collect on overpayments. There's 8 potential waiver reasons that are all based on finances. And if we were to try to collect on them, it would be against, goodwill and conscience. But we see the FPUC overpayment piece as much, much more of a problem. And so we've been trying to say to the feds, you really, as a nation, should waive the FPUC overpayments. And we haven't gotten there yet. They've been kind of, working around the edges on some increased opportunity for states to waive overpayments. But unfortunately, thus far, none of those have been applicable to Connecticut. So we continue to fight for that. And we too hope that there will be some relief and reprieve.
Okay. Thank you. And thank you very much for your answers and your time. And I look forward to voting for your confirmation very soon. Thank you, Mr. Chairman.
Thank you very much, Representative. Senator Kushner and Senator Moore, and then Rep. Vargas.
Thank you, Senator Duff, Chairman Duff. And thank you, Commissioner. It's good to see you here today. I, of course, have many opportunities to meet and discuss these issues with you, so I'm not going to ask a bunch of questions because I feel like I get a private audience whenever I need it. And I appreciate that. And by the way, that's for the record, that's because I'm the Senate Chair of the Labor and Public Employees Committee, not because of any favoritism on your part. So I do want to say a couple of things. First of all, I so appreciate the efforts of the Department of Labor, you and all your colleagues. I know you work tirelessly. I know from my many conversations with you that it was night and day, 7 days a week for many, many months. And I think that that must be acknowledged, and it must be, know that it's appreciated by many of us who are aware of how hard you worked. I also want to say that I think many of the decisions that were made, particularly sort of following up on Representative Quinn's comments about overpayments, I think were made in the moment were good decisions. They were important decisions that, including the FPUC from the federal government, those payments kept our economy going. They kept our working families alive. And I can't stress how much I believe that you all and the federal representative made the right decisions to extend those monies to as many families as was possible under the circumstances. I've dug into this question a bit with you. I intend to look at it further, but I think it underscores something that I did want to raise with you that I wanted you to expand upon, is that we're not really over all of the impact on DOL from the pandemic, that this work, particularly around overpayments, but in other ways too, is continuing to have a very profound effect on your department and on your work. And I wondered if you could address that a little bit.
Thank you. I really appreciate the opportunity to speak to that, because you're right. We still are in a real pandemic crisis, if you will, a pandemic volume of workload. And the reason for that is because, any particular claim, the extended life of a claim can be as much as 8 years when we're looking at all of, kind of statutory life of a claim. And so what's happened is, in addition to the timing of things like the reemploy CT, the new modern system happening during a pandemic, we also have this historic volume, so we had 400,000 weekly filers at our peak in May of 2020, 10 times, a decade's worth in that first year. And so it kind of follows like, a river through the department. So in the beginning, the issue was you have so many applications, so many filers, and we've got to get money out to people immediately because, they need this to put food on their table and keep their roof over their head. And then as that progresses and you get to the point where, then it's going down to there's appeals, which are where we see our most significant backlogs right now, and where I'm shifting folks. I'm bringing on durational employees, training them up, trying to get them so that we can get those appeals numbers down. But then there's the whole back end as well. There's the tax end, there's the accounting, there's closeouts, So our agency for a few more years will really still feel as though, we are in that pandemic predicament. And I appreciate your acknowledging that, because in some ways business is back to normal, in other places and in other parts of the state, and there's that expectation. But we still are, our staff are still going full throttle.
Thank you for your response on that. I also want to say that I think it also underscores the need for staffing up the Department of Labor, primarily because I think it puts us in a situation where we're not able to, we're so busy taking care of the immediate business that is essential to address, that I think it really constrains us from being creative and innovative and looking forward to the future about all the things we need to do. So I've told you this before, but we fully support making sure that our Department of Labor is staffed appropriately to make sure we're addressing the needs of the working families of Connecticut. I don't want to take any more of the time in this hearing, but I do look forward to working with you closely to address this overpayment situation, because I think I understand all the complexities, all of the difficulties, the responsibility of the federal government, but it is an area that I think we need to put our heads together and figure out how do we, relieve some of the anxiety that working families are feeling from these overpayments as quickly as possible. So I look forward to working with you on that.
Thank you.
Thanks, Senator. I think a lot of us share that sentiment as well. Appreciate that. Senator Moore, followed by Representative Vargas.
Good morning, Dante.
Good
It's
morning.
been some journey, my dear. Good to see you. Congratulations on this appointment.
Thank you, Senator.
Dante knows that I was angry at her for a while because she left the Senate. She actually told me the same. I said, yeah, I thought we had a good team and you all left me. So congratulations. Everybody grows. It's part of the process, right? So I'm glad we have someone there who understands our role as legislators to be able to work with a commissioner. So Representative Kennedy and Senator Kushner talked about it a little bit. Your call center is not a call center. I think you have a lot of temporary workers working for you. I'd like to know more about who's answering the calls and what's the plan for hiring permanent people. I have a friend who works for the Department of Labor in Bridgeport that's been there almost 50 years, right? She's one of the few people who plans on working until they drag her out of there, right? But there's a lot of history, there's a lot of knowledge that's leaving. And I'm just wondering, what is that? What are your plans to replace those people? And is there going to be this point where they're overlapping so they can learn from people who have more experience? Because I think what we were not prepared for with the COLA system and all the other things and lack of staffing was handling so many claims. So what did we learn from that? But also, what's the plan for beefing up your staff? And will it be remote, or do you plan on using more temporary workers?
Well, thank you, Senator. And I continue to remind you, it wasn't intentional to leave you. And as Senator Kushner said, getting back to, being able to do proactive things. One of the last things that we were able to do before the pandemic hit was we were in Rhode Island together at a conference about 2-gen approach to, the whole family approach to workforce and jobs. And that is absolutely something that, we're pushing through to want to continue and be proactive and stuff. So thank you for all of your work on that as well. As far as the calls, we're calling it a consumer contact center because we have multiple ways. It's phones, it's text, it's cases done by email. As a matter of fact, we've done over 2.1 million calls and cases since we established this. So that's extremely important. What we had to do is we've taken about 15 of our permanent expert unemployment insurance, past call center supervisors. So about 15 of our staff are overseeing the temporary staff that are working on the contact center. Now, those temporary staff, some of them have been there, we're just about marking 2 years. We will be marking 2 years very soon, right? So what we've done to be able to try to keep this knowledge, because we take the time, we train people, and the last thing we want to do is see them leave. But because of the temporary nature of the jobs, we have had a pretty high turnover rate. And that has been something that we've been working with OPM and talking about in the governor's office, which is why I'm extremely pleased that there's proposals for additional funding to keep these folks going. And every time we know that we can keep them longer, we communicate that with them. We also have, because of the legislature by the last year's budget, y'all put in there 2.37 million, I think it is, for the FY23 session, so that we can bring on some of these folks in a more permanent nature. So that's thanks to you. The other thing that we've done to try to create stability and permanency in the contact center is we've worked with Department of Administrative Services very hard for the last year or so on changing and broadening our job specifications. So one thing I learned when I got into an agency is that each agency has very specific job specifications and job classifications. And there might be a general, for instance, a consumer service representative throughout the state, but then there's the job specifications when you're in Department of Labor are very specific. So what we were finding is that job specifications, you almost had to be in the agency to get the job, because where else could you get unemployment insurance experience, which was required to be hired. So they worked with us to broaden these specifications to say that time in the contact center or time in as a temporary staffer would actually be the qualification. So we're just now seeing the benefits of that. And we're just about to post for additional permanent hires for the contact center, which I think are going up in the next couple of weeks. So we're working really hard at that succession planning and accounting for an immeasurable amount of knowledge that will be leaving through these retirements. We've been focused on cross-training. That's all stuff we were doing before the pandemic. It became really hard during the pandemic to do all of that cross-training and preparation, but we are doing it, and we are having success.
So thank you. And I look forward to seeing what that plan is and that we're able to get that done in the way of hiring. And you're considering people who have been temporary workers. Is there a limit on how long they can be temporary?
There's not a limit on how long they can be temporary. That it is something that we get approvals on. There are differences between temporaries and durationals. It gets a little bit technical, but no, we have the ability and the approval right now to be able to extend those folks at a minimum till June of 23. We recently were able to get that approval, and the positions, just to clarify, they will be posted as public positions, posted for the public, but one of the minimum qualifications will be satisfied by, regardless of educational experience, regardless of any other work experience, the 2 years as a temporary employee with us will become a qualification, which is something we felt was really important to keep the people we brought in, invested in, trained in, and also for a more diverse community of workers in our agency in a lot of ways, including educational background.
So thank you. And I look forward to working with you in the future at whatever place you're at that time. I'm here. Thank you. Thank you, Mr. Chair.
Thank you. Thank you, Senator. Representative Vargas, followed by Senator Summers.
Thank you, Mr. Chairman. I'm in the middle of a million things, but I just wanted to log on to say that I've known our Commissioner designee Dante Bartolomeo for a long time. I served on the Children's Committee with her when she was the Senate Chair. And I've got to say, very few people I've met with more integrity and courage than her. When she chaired the Children's Committee, she fought for the kids. Didn't matter if the leadership was angry at us for some of the bills we put forward. She was a true trooper and a true fighter. I can't think of anybody I would rather support for the chair of the Labor Committee. As a Deputy Labor Commissioner, she did a lot of hard work during a very critical time for my constituents. So I'm looking forward to voting for her confirmation. So thank you very much, Mr. Chairman. Thank you, Dante, for all you do.
Thank you so much. This is getting hard to handle.
Thanks, Representative. Senator Summers.
Yes, good afternoon, and thank you for all that you've done with the Department of Labor. I know it's been a really difficult task with everything that we've experienced over the past couple of years here in the state of Connecticut. I had a couple questions, and I can get you the specifics afterwards, but there are instances where the state General Assembly has passed laws for Department of Labor to enter into certain requirements to do for, let's say, workforce development, et cetera. And it's been a couple of years and they still haven't actually implemented what was passed a few years ago. If those are things that we can bring to you, would you be able to get back to us as to what's happening or why these things haven't been implemented? I know that this is before your time, so it would be a little bit of catch up, but those are things that are concerning to some of the legislators that I've talked to. You know, we've passed laws for the Department of Labor to go do certain things. The time has passed, it hasn't been implemented. Granted, we've had COVID in the mix, but I think it would be important if we can get you that list, if maybe you could respond to us. Obviously, this is before your time, so it would just be sort of catching up to where we should be on laws that we have passed. Is that something that you would entertain?
Oh, yeah, that is a concerning statement for me to even hear, whether I was here or not, because I'm not aware of anything. So please do right away. Yes,
I do. And I know Senator Formica has more information on it, but that's something that I wanted to bring up. The other thing that I wanted to just get your opinion on is that we do have laws on the books. Granted, over time, they have been tweaked a little bit, but that requires labor unions to provide their annual financial reports to the Department of Labor. I'm sure you saw the article. So union members and non-union members have access to those financials. And I don't know when it's stopped, but that has waned. So the Department of Labor is no longer getting those reports. And there has been people that have contacted DOL and asked for them, and you don't have them any longer. So, private sector union members have these protections under federal law, but it's up to the individual states, obviously, to provide similar protections. And if the state is going to require agencies and local governments to collect dues, I think we have a responsibility to make sure those dues are going where the members believe that they are. So do you have any plans to start, because that law still is on the books, to start collecting those financial reports that are really required by law that, I don't know when it weighed or why we're not collecting them any longer. Again, way before your time, but something that we should be looking at.
Yeah, thank you. Now I'm better understanding when you mentioned that, what you might have been referring to. So there's a few things on that. So first of all, when that I think that article came out, I don't know, 6 months or so ago, maybe 9 months ago now. That was the first I had ever known or heard of that. I checked with our attorneys who have been here for a very long time and said that was, I think there was maybe like in a decade, maybe one request for them. The reason that my understanding, the reason that they weren't done is, first of all, it was a law that was put in place over 60 years ago. It was something that it's redundant to federal law. So they are required to submit, and they do submit to the feds. And that information, is done there. So my understanding is there was redundancy. There's two other really important things here. One is the way the law is written, we're not allowed to provide that information to anyone, not to the general public. The information is supposed to be collected, sent into us, I should say, not collected by us. They're supposed to actively send into us. The only recourse we would have is a $25 fine because it was such an old law. So, and then the other thing is it's only union members who we are allowed to provide that information to if asked. So there's kind of a lot of oddities around that. And again, it's duplicative of what's sent into the feds. So I think that's, pretty much the basis behind all of that. It also, I have to be honest with you, if it were to be enforced with a $25 fee, it would cost the agency more to enforce that than we would be able to collect if it wasn't complied with. So if that's something the legislature is wanting, maybe it would be a good idea to reevaluate how it's structured. And again, it's going to the feds as well.
No, I realize that it looks like in 2014 there was a proposal to repeal it, but it wasn't repealed on the state level. And I thought it was also available to non-union members also, but
No,
I got it wrong. But
yeah.
I think that we should look at it because it's messy, whether it's upgrading, bringing the fine up to what 2022 standards are, or cleaning it up so that people that are concerned that maybe in the union, because I know that there have been union members that have requested that through the state, and obviously we were not in receipt of them, so we couldn't turn them over to them, that they have a clear indication of where their dues is. And it's strange that the law originally says that it's up to the state to make sure that these disclosures are available to their unionized members. So I think it's something that we should look at, definitely. And I didn't know anything about it either until I read the article and was contacted by someone who tried to get some information from this on the CEA and was not able to, and that's how the whole thing spurred. So
yeah. So if I may, can I just add to that? So we have gotten some requests from union members, and we have provided them with links and information and contact information so that they could get that from the federal repository.
Okay. Well, I think maybe we should take a look at that. I know that there have been instances of, I don't want to, improprietary actions in some of the unions. So I think, not in Connecticut, but I think some union members are interested in having that easily disclosed. So I think it's something we should look at to clean it up either one way or the other. And just wanted to get your thoughts on it.
Yeah,
and I certainly don't want you spending more money than a fine, and a $25 or $50 fine is not going to make somebody submit a financial report, just so it's easily transparent for people that are looking to see it, that are part of the union.
Yeah, and we help them get it from the federal.
Great.
Thank you.
Thank you.
Thank you, Senator. Any other comments or questions from members of the committee? Any other comments or questions? I don't see any other hands up. Senator Summers, if you don't mind taking your virtual hand down. Thank you. Any other comments or questions from members of the committee? Okay. Senator Formica.
Thank you very much, Mr. Chair. Good afternoon. Commissioner, how are you?
I'm great. How are you, sir?
Good, thank you. I'm sorry, I'm on a public hearing with energy and technology, so I'm a little bit late monitoring, but I did hear that Senator Summers mentioned some of that program. Just so you know, it's the apprenticeship program for the cosmetologists and hair salons that was passed by the legislature some years ago that has yet to be implemented so that the local hair salons can begin to work with that. So I just wanted to put that out there, seeing the subject was brought up, and you can get back to me whenever you find that information.
Okay, thank you.
And thank you for your hard work. I appreciate it.
Thank you.
Thanks, Mr. Chairman.
Thank you, Senator Formica, and good luck with your energy hearing on those non-complicated issues that you hear so often. Anyway, any other questions or comments from members of the committee? Any other questions or comments from members of the committee? Okay, seeing none, we'll ask the question. Commissioner, is there anything in your past that you believe might prove to be embarrassing to the committee, to the governor of the state of Connecticut?
No, there is not.
Okay, thank you. Have a great day.
Thank you. Thanks, everybody.
Thank you. Love your office. All right, next is Commissioner Navarrete here.
Yes, I am.
Hello, Commissioner. How are you?
Very well, thank you. How are you?
Good. All right, let's, so we're running late here. We're running long, I should say. Would you raise your right hand, please? Do you promise, swear, or affirm to tell us the truth, the whole truth, and nothing but the truth?
Yes, I do.
Great, thank you. Proceed with an opening statement if you have one.
Thank you so much. Good afternoon, Chairpersons Duff and Concepcion, ranking members Kelly and Kennedy, and other distinguished members of the Executive and Legislative Nominations Committee. For those of you I have not met yet, I am Nancy Navarrete, Interim Commissioner of the Department of Mental Health and Addiction Services, or DEMAS. It is such an honor to be nominated by Governor Lamont to serve as Commissioner of the Department of Mental Health and Addiction Services, a behavioral health care agency that provides services to over 100,000 individuals who are living with mental health and substance use conditions each year. I appreciate the opportunity to appear before your committee today. I would like to begin my remarks by thanking the governor for nominating me for this position. I do not at all take lightly the trust he has placed in me to serve Connecticut and the behavioral health community. I am a lifelong resident of Connecticut, and my entire professional career has been in service to individuals living with mental health and substance use conditions. I did my undergraduate work at Boston College in Massachusetts and completed my graduate studies at Fordham University in clinical psychology. I'm a licensed counselor myself in both Massachusetts and Connecticut, and I'm nationally certified. I started with DEMAS in public service in 2013. I was hired as the Director of Behavioral Health Services at that time and reported directly to the Deputy Commissioner. I was overseeing various departments, including managed services, community services, evidence-based practices, women's services, housing and homeless services, and a few others. In 2015, I was promoted to the DEMAS Deputy Commissioner role and was responsible for project management and strategic planning as part of the executive team. And I continued to manage these other divisions as well. And I provided leadership of initiatives supporting the recovery of individuals living with mental illness, as well as leading the state's opioid response efforts. So prior to public service, I spent many years first as a mental health and addictions direct service provider myself, and then moved into executive leadership roles as a healthcare administrator. My senior leadership roles included working as Chief Operating Officer at Liberation Programs, which is in Region 1 down in that part of the state, and as Chief of Behavioral Health Services for Cornell Scott Hill Health Center, which is an FQHC in Greater New Haven, serving Region 2. I've also, during this time since 1996 and until recently, maintained a general outpatient counseling practice. And then to ensure that I remain up to date on both the counseling side and executive management, I maintain memberships with the American College of Healthcare Executives and American Counseling Association. During my tenure with DEMAS, including the past 8 months as acting and then interim commissioner, I have prioritized expansion of an accessible, integrated behavioral health system. My goals as commissioner would include continued leadership in addressing the opioid crisis, integrating mental and physical health care to ensure the long, healthy lives for the people we serve, because we know they die at least 25 years earlier than their counterparts, and amplifying the continuum of the adult crisis response. That said, there are a number of challenging issues that are facing Connecticut behavioral health systems in the upcoming years. Connecticut must continue to address the public health crisis related to opioids, particularly the lethality of fentanyl that we've all heard about, while also grappling with the after effects of the pandemic that have contributed to the strain put upon the behavioral health system. Connecticut must continue to promote prevention, utilizing best practices such as public education and overdose prevention through the widespread availability of Narcan, while ensuring treatment options for those struggling with addictions, and make sure those options are available when people need them. The promotion of mental health treatment must be a priority if we are to see ourselves through the aftermath of this pandemic successfully. The healthcare worker shortage seen statewide and nationally cannot be understated. We must be able to deliver mental health and addiction services to individuals when they need them in a manner that they choose. Connecticut has always been a leader in the adult mental health arena, and I look forward to building that foundation. Fortunately, DEMAS has the tools and resources to overcome some of these challenges. We are connected to 140 private non-for-profit agencies that we partner with to provide services. I am looking forward to working with colleagues from my sister state agencies, including OPM, Judicial, Departments of Correction, Housing, Children and Families, Developmental Services, and Social Services. Our work together braids necessary services for our clients across the lifespan, diverting them from jail, transitioning them across specialty services, and ensuring individuals have adequate resources for a life in the community. In addition to providers and state departments, I especially look forward to partnering with the recovery community. Individuals with lived experience are integral to shaping our successful and nationally recognized system of support and care. Together, we will continue to strive for excellence in whole person healthcare with a sense of urgency, respect, and kindness. So in summary, the prospect of leading this unique and diverse agency with its very dedicated healthcare staff is a wonderful opportunity to serve the state of Connecticut and to participate fully in the forward momentum of behavioral healthcare. I respectfully ask for your confirmation of my appointment so that I can build on the already great work that is occurring at this agency. Thank you, and I would be happy to answer any questions that you have.
I think I'll take over here. Thank you so much, Commissioner. Appreciate your time today. I know it's been kind of a long day, and congratulations on your nomination. I look forward to your support. One question I did have, trying to see, does DEMAS actively work with local police departments when it comes to whether it's training or even straight partnerships as they are going out and trying to intervene with some of these mental health issues in some of the local police departments?
Thank you for that question. Yes, we do indeed. We have local mental health authorities, or LMHAs, across the state. So some of those are state operated and some are operated by our private nonprofit providers. The LMHAs are very much connected to, I think some folks are calling them citizens crisis response lines, alternatives to 911, civilian responses to mental health and wellness checks. So different cities are doing it differently. There's some work being done in New Haven, some work being done in Hartford. Bridgeport, one of our PMPs, is partnering with the Stamford Police Department to provide a social worker in the police department so that when something comes up, that individual can be diverted and there's not a rescue response, there's a trauma-informed mental health response to that person. So the short answer is yes, there are many initiatives across the state. We also train police departments in CIT, and that's done by critical intervention teams, and that is done by our partner, Cable. So again, a very trauma-informed, mental health-informed response to a crisis.
I appreciate those comments. I think that is extremely critical, as police departments continue to have to deal with this mental health crisis, ensuring that we arm, I say arm, but I mean make sure that they understand the position of the mental state of some of our individuals here in the state. So appreciate that. One other question, I was hoping you could just expand a little bit on what DEMAS's approach to the opioid crisis is. What have we done over the last couple years, and then what should we expect over the next few years or so to continue to combat this incredible crisis that I think everyone on this call has, in some shape or form, has been affected by it.
Absolutely. This has been a horrific crisis. It's been tragic in that it's affected so many families and so many individuals across the state and across the nation. Connecticut has been proactive for many years now in addressing this crisis through prevention, through treatment, through recovery supports, and through criminal justice initiatives. We have taken a harm reduction response, an approach most recently. I think we have reached a lot of people to reduce the stigma so that people can ask for help and ask for Narcan, for example. So that would be a prevention effort. For somebody that is still using, we want to be able to get that medication out to them so that they can, if they're going to continue to use, have the tools to use safely and have a chance to live another day to find recovery. So the department definitely supports all pathways to recovery, from everything from medication-assisted treatment to recovery support systems through people with lived experience. And both of those types of interventions, for example, have evidence base behind them. There's a protective factor with medication, and there's a protective factor with having a meaningful relationship with someone who has walked in the same shoes that you have. We have interventions for parents. We have resources for parents and how to talk to your children about substance use. We have collaborated with DCF and with SDE to make sure that these resources are age appropriate. Commissioner Durantes and I co-chair the Alcohol and Drug Policy Council together. And we also look forward to the hard work that the AG's office put into the opioid settlement dollars. Those should be coming through over the summer, and we'll be putting together an advisory so that those funds are distributed equitably and are distributed using evidence-based practices.
I appreciate that. You know, this like one of the hardest things is trying to eliminate the stigma of this crisis. This crisis doesn't matter how much money you make, doesn't matter where you live. It affects us all. So kind of eliminating and ensuring that our parents, the parents of our children, have the right information on how to speak to their children. And again, it's a stigma that needs to be eliminated on this crisis. So appreciate all the work that Demas has done already, and will continue to do over the next however many years this crisis stays with us. One last question for me, and I asked this question to both the commissioners of education and commissioner of public health, is how closely do you work with your colleagues from our neighboring states when it comes to just preventative procedures or anything that they are doing that is working that we can do as well. So just curious to hear the relationship you may or may not have with some of our neighboring states.
There are the commissioners, deputy commissioners, and key contacts at state agencies are part of national associations. So there are advocacy groups both for mental health and for substance use disorders. There are a lot of listservs. There's access to literature. There's an ability to meet with your fellow commissioners across the nation. We also have regional meetings. So I meet periodically with other commissioners from the Northeast, and so does my women's services person, so does my prevention person. So it's a great way to be able to exchange ideas and really stay on top of what the best practices are. We also have an embedded research unit within Demas that are folks from UConn. So we contract with them, and they are great about, again, keeping on top of the literature, evaluating our programs to make sure we're on track and we're doing things that work, and giving us access to what's going on nationally and internationally.
That's great to hear. Again, congratulations on your nomination. Thanks so much for taking the time. I will open it up to any questions or comments from my colleagues. And Representative Kennedy, do you have anything?
Thank you, Mr. Chairman, and thank you, Commissioner, for being here. It's been nearly 4 hours, 3 hours, so we greatly appreciate it. Chairman Concepcion touched on a number of things in mental health with, we talk about our children, but it's actually with our parents as well and our seniors. So I guess one of my questions would be, is site homes, group homes is that a problem finding locations throughout the state when you're going to, I know recently there was one and there was a lot of friction and people that were opposed. How does that work?
I think the key is doing your homework ahead of time. So meeting with local communities, talking to folks, educating them about what services you're going to offer. But yes, it is a challenge. There, Rep. Concepcion mentioned stigma. There still is stigma in mental health and substance use. So that is real. But it's having those difficult conversations and being prepared to talk to neighborhoods and people and educating people about the services that will be offered.
And then just, I think most people are aware of it. There was a group convened to study the use of psilocybin.
Yep.
And I served on that working group. I wondered if you had the opportunity to look at that report, and could you share your thoughts if you're...
Sure. I think whenever we're faced with mental health conditions that are treatment resistant, we have to look at alternatives. Or if there is something that has serendipitously come to our attention that may have been a medication that may have been used for something completely different, and we find, hey, this medication lifts depressive symptoms, or this medication is helpful with PTSD. I think we have to look at all of those options because there's not one pathway to recovery. And so this is an exciting opportunity to really gather additional research, look to the FDA to see if the medication will be approved, and it looks like it's moving down that track, and then being able to down the road integrate that into our arsenal of what is available to help folks that are suffering.
Thank you very much. I know a number of veterans have testified about that. The last thing is that you touched on the shortage of healthcare workers, especially our LCSWs, and it's really, the pay isn't the best and it's hard. How can we go about getting more people for the jobs, and like how does that impact? We have a number of mobile crisis units that we have out. Are they being impacted by that shortage, or what can your department, what can you do to ensure that we have enough people that...
Yeah,
I mean, tough job. It's a tough job.
It's a real challenge. It's a challenge nationally. We see our, other agencies and hospitals are struggling with the same issue. So there's a national workforce shortage overall. Then the next cut is healthcare, and then the next cut is behavioral healthcare. So these are very challenging jobs. You're giving your heart and soul in helping people, being empathic, going to work every day during a pandemic, and people have gotten burned out. I mean, it's a lot to ask of people. So that's understandable. I think if you look at some of the proposals in the governor's budget, there are some exciting things that are proposed there. Loan repayment, being able to do tuition reimbursement, adding to faculty state in schools so that we can fill more seats with additional people who may be interested in going into behavioral health. So we do have our work cut out for us, but I think we are paving a pathway so that improves.
And those certainly are incentives that will hopefully be, I know my daughter is studying her master's for an LCSW, and I was kind of like, are you sure? But if you have it in your soul and your heart to do it, it's a great, profession. Commissioner, thank you so much for staying with us all morning.
Thank you.
Thank you. I'll yield to the next speaker. Thank you, Mr. Chairman.
Thank you, Representative. Senator Moore.
Thank you. Congratulations on your appointment. I look forward to working with you. A little earlier when I was speaking to the commissioner to be approved for public health, I talked about the gun violence. You've talked a little bit about the substance abuse and programs and mental health. How do you work with the Department of Public Health regarding the trauma that not only the children, because the children, I think that's an issue that we need to deal with on a different level, but also the parents of those children who sometimes have lost a child, lost a member of the family from the gun violence. I'm trying to understand your role as behavioral health versus public health. Can you give me a little background on that?
Sure. So our departments have different missions, of course. So DCF, DMIS, DPH, but our values are the same, right? We want healthy kids, we want healthy adults, we want healthy families. And so we partner in many different ways, depending on the topic area. So we are the Lifespan Prevention Agency. We walk very closely with DCF, and as I mentioned, with SDE, the State Department of Education, and DPH, Department of Public Health. There's a lot of coordination so that there's not duplication of services, and yet we're informing each other in each content, wherever we have content expertise. So with opioid overdoses, as an example, DPH has done a phenomenal job in collecting the data about non-fatal and fatal overdoses, as close to real time as we can. That information is shared with us, and that way DMIS can then target our response in the communities that are most effective. If we see that there's an alert where there are overdoses in a certain city or certain town, we can alert our providers. We can get Narcan out to that community, and we can pivot and make sure we get the community what they need. And that's how we work together. The same thing with children's services and transitioning children from DCF to DMIS. We don't wait until children are 18 to start that process. We start those relationships when they're 16 so that they get to know their providers, that everyone's on board with their treatment plan, and that the transition is smooth.
Thank you. So I look forward to working with you. I know the governor's done from the day he walked in at coordinating services among all the health agencies.
Mm-hmm.
And I've had a great relationship with the Commissioner of Public Health and DSS, working with them. And I look forward to working with you in the future. So thank you.
Thank you, Senator Moore.
Thank you, Mr. Chair.
Thank you, Senator. Are there any other committee members that want to ask any questions or comments? Seeing none, Commissioner, before we say goodbye, there is one question we ask of every nominee. Is there anything in your past that you believe might prove embarrassing to this committee, to the governor, or to the state of Connecticut?
No, there is not.
It's wonderful. Thanks again. Thank you again
you.
for taking the time. Look forward to working with you in the future.
Same here. Thank you so much.
Thank you. I know there are a few members from the audience that have would like to testify from the public, and I believe I have the list here. The first one, and correct me if I'm wrong, Madam Clerk, the first person I have on my list is Kate Diaz. Is Kate Diaz still with us? I don't see Kate, so we will go down the list. Is Catherine Awad with us?
Yes, sir.
Oh, wonderful. Did I pronounce it correctly?
You did. Thank you very much.
Okay, wonderful. The floor is yours.
Thank you very much, sir. First of all, it's an honor to have the opportunity to appear before you today. And when this did start, it was morning, but I will revise my remarks. So thank you and good afternoon, honorable members of the Executive and Legislative Nominations Committee, for allowing me the opportunity today. It is indeed my pleasure to offer testimony in support of the nomination of Dante Bartolomeo to serve as the Commissioner of Labor for the state of Connecticut. As noted, my name is Catherine Awad, and I am the President and CEO of the Northwest Regional Workforce Investment Board, and we currently serve 41 municipalities in the northwest part of Connecticut. I've held this position for 21 years, during which time I have seen 6 commissioners of labor have the opportunity to work with 6 different commissioners. And from the moment that she was appointed as deputy commissioner, it was very obvious that Commissioner Bartolomeo was taking a deep dive to educate herself to the absolute highest level about the workings of, and more importantly, the needs of the agency and the many units that make up the Department of Labor. Specifically in the area of workforce development, it was very clear that the commissioner sought to understand the intricacies of the workforce system and to assist the state's 5 workforce boards in assuring the best possible outcomes for both job seekers and employers throughout the state. As the world turned upside down in March of 2020 and the Department of Labor was tasked with implementing a multitude of federal pandemic-related unemployment programs, she engaged the workforce system partners to assist with frontline services to the Connecticut residents while splicing together an antiquated technology system to deliver unemployment benefits to Connecticut residents displaced by the pandemic. Commissioner Bartolomeo, in my mind, demonstrates an extraordinary commitment to the staff at the Department of Labor, as well as the entire workforce throughout the state of Connecticut. And it has been my pleasure to work with her, and I continue to look forward to doing so in the future. And I truly appreciate your time to offer this testimony this afternoon. Thank you.
All right, thank you very much. Oh, hello, thank you, Representative Concepcion, Mr. Chairman, for taking over there. I appreciate it very much. Next is Jan Hockdell from AFT. Hey, Jan.
Hi, thank you. And good afternoon, Senator Duff, Representative Concepcion, and members of the committee. I am Jan Hockdell, President of AFT Connecticut. And I too am testifying today on behalf of our 30,000 members, especially the nearly 10,000 state employees we represent. And I speak today in strong support of Dante Bartolomeo as Commissioner of Labor for the state of Connecticut. And like many others, I first met Dante when she was in the legislature. And when I moved to Meriden, she was my state senator. I was immediately impressed by her knowledge of the issues facing her working class district, her fierce advocacy for her constituents and fighting for economic and social justice, and her understanding of how government, business, and labor can work together to improve our communities. It was truly amazing. In 2017, Dante convened a meeting of labor leaders to talk about the issues that were facing Connecticut. She genuinely wanted to hear our concerns and discuss not only problems, but solutions. And while working on the gubernatorial campaign, she organized several meetings with labor leaders and rank and file members to discuss those issues. And it was inspirational to see how empowered our members felt by the opportunity to have a conversation with a future governor. It was something that they never imagined possible. And it was Dante's insistence that working people have a voice that made those meetings possible. I was excited when Dante was appointed as Deputy Commissioner of Labor. The position was perfect for her talents, her knowledge, and her passion. She has been able to use her unique understanding of the levers of Connecticut's government and the needs of working people to help guide what has become an outdated labor department to a more robust and efficient resource for Connecticut citizens and the economy. And as she testified, the pandemic meant people were not able to report to work, and an enormous number of people were relying on the Labor Department for funds to keep their lives going. And with Dante's leadership, the department met those challenges and was able to keep Connecticut moving forward. Dante is organized, passionate, empathetic, and as Senator Kushner said, she's really hardworking. Her desire for true collaboration has helped guide our state through these really challenging times. And as Deputy and Interim Commissioner of Labor, she has forged alliances that seem unlikely and reached consensus that seemed impossible. As everyone in labor knows, she does not take no for an answer. I look forward to continuing to work with her in the future, and I'm really excited to see the ways that her leadership will benefit the citizens of our state. I strongly urge you to approve Dante Bartolomeo as Commissioner of Labor. Thank you.
Thanks, Jan, appreciate it. Ed Hawthorne, are you on?
I am, Senator.
Hey, how are you? Oh, hey, there you are.
Good. I was hiding in the Zoom land, but good afternoon, Senator Duff, Representative Concepcion, and members of the Executive and Legislative Nominations Committee. My name is Ed Hawthorne. I'm proud to serve as the president of the Connecticut AFL-CIO, a federation of hundreds of local unions representing more than 200,000 workers in the public, private sector, as well as the state building trades. It's on their behalf that I appear before you today to support the nomination of Dante Bartolomeo, the Commissioner of Labor. Prior to being elected president of the Connecticut AFL-CIO in October, I worked as an appeals referee for the Connecticut Department of Labor for over 10 years. I've been in meetings with Interim Commissioner Bartolomeo. I've seen her take the wheel of a ship and lead this department through a time when we needed somebody to lead. Remember, at the beginning of the pandemic, CTDOL had no contact center or no call center due to a prior administration cutting funding for those services and laying off workers. We were forced to shut our doors due to a virus decimating our communities and nevertheless still find a way to provide service to an unprecedented number of claimants desperate for help, many of whom had no prior experience dealing with this system. Moreover, CTDOL was tasked with implementing a never-before-seen expansion in benefits. Through all of this, Interim Commissioner Bartolomeo was there to make it happen. She's the first one in, she's the last one out every day, and someone who truly cares about the mission of CTDOL. Next up for CTDOL is the modernization of our extremely old system based in COBOL technology. And I can tell you from firsthand experience, it's not easy to deal with. It's a tall task to undertake, but I'm once again confident that Interim Commissioner Bartolomeo will get the job done as she has in the past. Connecticut AFL-CIO applauds Governor Lamont for appointing a commissioner with such strong background in public service. As former deputy labor commissioner, former state senator, Commissioner Bartolomeo's various roles have provided her with a level of versatility and direct knowledge of challenges Connecticut workers face on a daily basis. She has a passion for problem solving, and her tenacious advocacy is well known throughout the Capitol complex. Interim Commissioner Bartolomeo has consistently maintained an open door policy, welcoming questions and feedback on issues of importance to labor. Connecticut AFL-CIO and its affiliates, one of which being my local, AFSCME Local 269, have benefited from productive dialogue and enjoyed a collaborative relationship with her as well as her team. We look forward to continuing that partnership throughout her tenure as commissioner. She's very well qualified to be the Commissioner of Labor. I urge you to give her your full support and act favorably upon her nomination. Thank you for your time and attention. I'm happy to answer any questions that you all may have.
Thank you, Ed. Appreciate it. Okay, next is Kate Diaz. Did she speak yet?
I don't believe she was on the call. She might have dropped out.
Okay, next, Ron Alderman. Alderman.
Good afternoon. I'm Ron Alderman. I'm a practicing physician and also president of the Connecticut State Medical Society. On behalf of the State Medical Society, we want to express that we strongly support nomination of Dr. Manisha Jutani for the Department of Public Health. Dr. Jutani is a recognized expert in medicine, in infectious diseases, and public health. Her expertise and extensive knowledge in infectious diseases come very handy and especially very valuable during the COVID-19 pandemic. She is the best person at the right time in the right situation. As one of our colleagues, Dr. Nancy Brown, has stated, Manisha Jutani has the expertise and skills to have a significant positive impact on the health of the people of our state. So we very strongly support her nomination.
Okay, thank you so much, sir. Appreciate it. I think that, Madam Clerk, are there any other speakers signed up?
No, sir, that are here anyway.
Okay, thank you. I think that concludes our public hearing. Is that correct?
Yes.
Okay, thank you. So we will adjourn our public hearing and move into our committee meeting. And so we can now convene the Executive and Legislative Nominations Committee meeting to vote on those who we just heard at our public hearing. Mr. Chairman, any comments? Okay, great. I'm moving on to the next item on our agenda would be House Resolution for Manisha Jutani of Southport to be Commissioner of Public Health. Is there a motion?
So move.
Second.
Moved by Representative Godfrey, second by Representative Concepcion. Any comments? If not, Madam Clerk, this is just for House members. Madam Clerk, please call the roll.
Representative Concepcion.
Representative Concepcion is a yes.
Representative Quinn.
Representative Quinn votes yes.
I didn't get you on camera, sir. Would you please say that again?
Sure. Representative Quinn votes yes.
Thank you. Representative Kennedy.
Kennedy votes yes.
Representative D'Agostino. Representative Godfrey.
Aye, Representative Godfrey votes yes.
Representative Perillo. Representative Yacarino. Representative Vargas.
Representative Vargas votes yes.
Mr. Chair, that's your roll.
Okay, thank you. We'll keep the votes open till 3 o'clock today. Next is Senate resolutions for review. First is Dante Bartolomeo of Meriden to be Labor Commissioner. Is there a motion?
So moved.
Second.
I'm sorry, this is just a Senate resolution, correct?
Yes.
I did not see who said the motion.
I was there about to vote here now. So we could,
Was that, moved by Senator Kushner. Is there a second?
oh, okay.
Okay, seconded by Senator Formica. Any discussion? If not, Madam Clerk, please call the roll.
Senator Duff.
Senator Duff votes yes.
Senator Looney.
Senator Looney votes yes.
Senator Looney, will you please turn your camera on so I can get you on record?
Yep. Senator Looney votes yes.
Thank you. Senator Kelly.
Kelly votes yes.
One more time, sir. You weren't on camera.
Kelly votes yes.
Thank you. Senator Fonfara. Senator Formica.
Formica votes yes.
Thank you. Senator Hartley. Senator Kushner.
Senator Kushner votes yes.
Senator Moore.
Senator Moore votes yes.
One more time, ma'am.
Senator Moore votes yes.
Thank you. Senator Summers.
Senator Summers votes yes.
Thank you. That's your role, Mr. Chair.
Thank you, Madam Clerk. Next is another Senate resolution, Nancy Navarrete of Hamden to be Commissioner of Mental Health and Addiction Services. Is there a motion? Senators only.
So moved.
Moved by Senator Kushner. Is there a second? I'm sorry, is that Senator Summers? Okay, second by Senator Summers. Is there discussion? If not, Madam Clerk, please call the roll.
Senator Duff.
Senator Duff votes yes.
Senator Looney.
Senator Looney votes yes.
Senator Kelly.
Kelly votes yes.
One more time. We didn't get you on camera.
Kelly votes yes.
Thank you. Senator Fonfara. Senator Formica.
Formica votes yes.
Senator Hartley. Senator Kushner.
Senator Kushner votes yes.
Senator Moore.
Senator Moore votes yes.
Senator Summers.
Senator Summers votes yes.
And that's your role, Mr. Chair.
Okay, thank you. As indicated, we'll keep the votes open until 3 o'clock. We have a meeting, only one meeting next week on Tuesday at 10 o'clock. And so we'll see everybody then. Otherwise, have a great weekend, everybody. Thank you. The meeting is recessed.
Wendy?
Hi, Representative.
Hi, Wendy. I had to get off. I'm sorry. I've
No
been
worries.
the meeting the whole time. I'm going to vote.
Yes, just one second. Let me find the right one. I think you only have one. House resolution for the Commissioner of Public Health.
Yeah, I'm a yes. Oh, the others were just Senate resolutions?
Yeah. And it's odd because commissioners always are only confirmed by one house, which I always think is so crazy.
Should be both.
I know, because like people on rail and stuff are both, but that's how it is. So thank you very much.
Yes,
I'm glad I was able to get your vote.
All right, good. Thanks for everything. I'll see you next week.
Okay, see ya.
Bye. Bye.
Hi, Representative.
Hi, Wendy. How are you?
Fine, thanks. I must have been looking down for like the 1 second that you popped on earlier. You have just one vote, and it's for Dr. Juthani, the Commissioner of Public Health.
Right. No.
Okay, you got it. The others are Senate
Thanks.
resolutions. So
Yep.
you're off the hook. Thank you so much.
Thanks, Wendy.
Take care. Hi, Representative. You're on mute.
How's that?
Much better.
There we go. Okay.
I'm glad that you popped on. I texted
Yeah,
Jason.
sorry, I got a reminder from Jason. I'm just definitely
Hey, no worries. You only have one vote, and that is for Commissioner of Public Health, Dr. Giussani.
Agostino votes yes.
Alrighty, you're off the hook.
So much
Thank you.
appreciate it. Thanks.
See ya.